Hello, everyone, and a very warm welcome to you all this morning, afternoon, or evening, depending on where in the world you're joining us from. My name is Mercy Juma, a correspondent for BBC News and a strong advocate for maternal, newborn, adolescents' health and well-being. Now, for the next few hours, I have the pleasure of being your moderator for this very important event, the 2020 Accountability Breakfast. This is our 8th year of hosting the Accountability Breakfast on the side of the UN General Assembly. And we are not able to congregate in New York this year, but that has not stopped us from coming together and bringing to fruition these, very timely, urgent, and relevant discussions on the health and well-being of women, children, and adolescents. Hosted by the Partnership for Maternal, Newborn, and Child Health, PMNCH, the White Ribbon Alliance, and Every Woman, Every Child, plus many other supporting partners who are listed on this website. This event builds on the outcome of the Lives in the Balance Summit, a COVID-19 summit. That's what we called it on the 1st and 2nd of July. Now, we have a supercharged, highly interactive program outlined for you. We are bringing on board a range of stakeholders from governments to grassroots organizations, people with power to make the change, and people who are calling for those changes to be made. And before I go on, just allow me to express our heartfelt gratitude to the Right Honorable Helen Clark for her leadership during today's high-level discussion, and Her Excellencies Honorable President Kaliulai, Honorable President Zaudi, Honorable former President Ellen Johnson Sirleaf for joining us today. We would like to also welcome honorable ministers from India, Kenya, and Nigeria, as well as the Honorable Vice Minister of Health from Mexico, who will all be joining the conversations you're going to have later today. Now, ladies and gentlemen, just over 6 months into the COVID-19 pandemic, reports are showing that women, children, and adolescents are bearing the heaviest burden of COVID-19. We're seeing increased violence, we're seeing interrupted education, food insecurity, and disruption in health services. And these are just a few of the grave realities that women, children, and adolescents have to battle with every day. Now, more than ever, we need to come together and take action to ensure this group of people not only survive this pandemic, but they thrive even after. And that's why the focus today is on strategies, political commitments, and securing global accountability for protecting women's, children's, and adolescents' health and rights, not only during this COVID-19 crisis, but also beyond. And even as we listen to the list of amazing speakers and panelists we have today, we will get to hear from you, our esteemed audiences. And 1,500 of you, more than 1,500 of you from more than 109 countries. We are so privileged that you're here today. And we have a number of ways that you can, interact with us and our panelists. And on the homepage of this website, first of all, there is a map. And on it, I would appreciate if all of you can just click on your country or where you're joining us from. Let's all see how representative we are. And also there's a chat box on the right-hand side of your live screen. Please join the conversation there and keep it going. My awesome colleague, Jen Rabotata of the South African Broadcasting Corporation, is going to moderate the chat conversations therein. So please do keep her company and ask questions, share your experiences. And some of these questions and comments will be passed on to me by Jen and other colleagues who are monitoring the chat, because we really want this to be a highly interactive event. For now, let's look at the world map and see where all of you are from. And as we do that, feel free to share what you learn and what fascinates you from this event using our, on Twitter or social media. And look at that world map. Africa looks really good. We have people from all over. You can just click on it and, let us know where you're coming from. We have people. I really love the number of those I'm saying from my country, Kenya. By the way, I'm coming to you live from Nairobi, Kenya. So that's really wonderful. I love how populated that map is. And you can always access this from the Accountability Breakfast website. We have all this up there. So let's get started. And just before we get started, let me remind you that this event will be in English, but we have simultaneous sign language interpretation in both Spanish and French. And yes, like I said, please keep the conversations going. But to start us off, let's go to this beautifully animated film based on the testimony and lived experiences of women and young people from around the world. It was created by Studio Exaudros in Mumbai for the Accountability Breakfast with the lyrics of talented singer-songwriter Nazim in the Gambia. Take a look.
COVID-19, oh, it is real. It is real. Oh, it is real. People dying, oh, everywhere. People crying, oh, everywhere.
Hay días en los que no hay mucho que comer. Entonces hay que decidir y mi hermano es la prioridad porque es el más pequeño.
The choice that you make now can decide the future. The things that you do now can make a difference. We don't wanna suffer more. We don't wanna struggle more. Don't wanna suffer more. Living like this.
Ningokia kwa unyautuko. Nando ningokia kuwania skali. Nalia kwa tiyemeo ya kafyu.
Our communities must unite. Our leaders got to unite. We got to be ready. Let us make ourselves ready. COVID ready. COVID ready.
तो जिनके पास जो कपड़ा अवेलेबल था जो जैसा था फाड़ के कपड़े सब इधर उधर वही यूज कर रहे थे जो भी जिसके पास सामान था क्योंकि डरे हुए थे ना बहुत तो मांग नहीं रहे थे उनसे कैसे मांगे कैसे बोले कहीं ऐसा ना हो कि हम उनसे मांगे तो मतलब हमें डांट दें हड़काएं इसलिए सब लोग बहुत डरे हुए थे.
We don't wanna struggle more. We don't wanna suffer more. Living like this. COVID-19, it is real, but we are realer, and we are stronger, and we will conquer. We'll conquer.
Wow, what a powerful film. Dear Diana in Colombia, Agnes in Kenya, and Vina in India. Thank you for allowing us to share your experiences. Now, we hear you and we are with you. Now, ladies and gentlemen, the voices presented herein are the foundation of the discussions we will have for the next 4 hours. We are miles apart, joining from different corners of the world, as you've seen on that world map. And we indeed have our differences, but today we are all here in solidarity for the rights, health, and well-being of women, children, and adolescents. That, if there's nothing else, is our unifying factor today. And with that in mind, I have an ask from you. As we begin our program, and in the spirit of collaboration and of partnership, we are going to light a digital flame. Now, at the pulse section of this website, an image of a flame is projected, and there is a place where you can enter your name. Doing this is a sign of solidarity and a symbol of our commitment and partnership for ensuring accountability and protection of the health and well-being of women, children, and adolescents during and after COVID-19. So please go ahead and put your name there. And as we continue lighting up the solidarity flame, the wonderful Nazim, a singer and songwriter from the Gambia, whose COVID-ready song, as we have heard, has become an anthem for all of us who are keen to protect the progress for women, children, and adolescents. Nazim is here, and he comes with a live performance of his latest song, Time for Change. This song is written to reflect the aspirations of this event. The stage is yours, Nazim.
Hello, everyone. Hi. My name is Nazim, and I'm coming at you live from the Gambia, West Africa, from the sunshine, eh? This song is all about holding our leaders to account, yeah? And making sure nobody's left behind. The song I'm about to perform today is called Time for Change. Let's have a good time. COVID have changed the way we live. Destabilizing our communities and affecting women and children and adolescents. Let us leave no one behind. In the wake of the crisis, now is the time. Oh, it's time for change right now. It's time for change, it's time for change right now. It's time for change, it's time for change for greater equity and accountability. Let us look beyond our COVID crisis towards a vision of a healthier new world. Let's lead our people with accountability, rebuild the system and society. Let's write our own history and make a path for a brighter future. Yeah. Oh, it's time for change, it's time for change right now. It's time for change, it's time for change right now. It's time for change, it's time for change for greater equity and accountability. Our leaders gotta listen on to the people that deserve, cause we only really strong as the weakest amongst us. Decisions that we make can reflect in our future. We're running out of time, cause we only got one world. Oh, it's time for change, it's time for change right now. It's time for change, it's time for change right now. It's time for change, it's time for change for greater equity and accountability. Yeah, yeah. Stabba-dabba-dee-bee-dabba-da. 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 Da-da-da-da-da. It's time for change, it's time for change. It's time for change, it's time for change right now. It's time for change, it's time for change for greater equity and accountability. Yeah, yeah, yeah. Thank you very much.
Thank you so much, Nazim. It's always so refreshing to listen to you.
Thank you very much, Joanne. Thank you, Mercy.
I just like how you are channeling your energy and your songwriting skills to issues to do with COVID during this period, and especially on women, children, and adolescents. So thank you so much and keep it up. Yeah, so indeed.
Welcome, yeah.
Oh, great, thank you, Nazim. Indeed.
Let
us not leave anyone behind. It's time for change. It's time for change, as Nazim's song says. So my voice is definitely not as good as his, so I will not even attempt to sing. But what I know is that we need brave voices to speak out and demand for these changes. And one such voice we are so privileged to have is that of the Right Honorable Helen Clark, who will lead us through our first discussion in today's breakfast. Now, Helen herself is a model for change. This was a girl who grew up on a remote farm in New Zealand, but she became the first woman elected to be Prime Minister of New Zealand. She became the first woman leader of the UN Development Programme and contender for the title of the first ever female Secretary General of the UN. Another glass ceiling we are confident will be shattered soon. Now, today, Helen is the board chair of the Partnership for Maternal, Newborn and Child Health, and since July, the co-chair with Her Excellency Ms. Ellen Johnson-Sirleaf of the Independent Panel for Pandemic Preparedness and Response, Accountability and Women's Leadership. Is definitely the perfect topic for you, Helen. So over to you. And once again, thank you very much for joining us today.
Thank you, Mercy. And greetings from Auckland, New Zealand at 1:15 in the morning. And thank you, Nazim, for the most wonderful music. Loved it. I think that could become an anthem for many of us around the world. So the PMNCH Annual Accountability Breakfast is a bit of an institution at the UN in New York on the margins of the General Assembly each year. But of course, we can't be in New York for the UN General Assembly, so we're convening online. And the bonus of that is that, of course, we can involve so many more people than we could ever involve in a conference room or ballroom in a hotel in New York City. And we've also been able to gather this wonderful group of participants. And I'm just so thrilled with my panel with current and former heads of state and other prominent and eminent personalities. So we're here to talk on Helen's virtual sofa about women, children's and adolescents' health, a critical conversation to be having at this time. was only 2 months ago that many of us gathered, again virtually, for the first Lives in the Balance Summit. And we were discussing then the early forecasts of what the impact of the disruption brought by the COVID-19 pandemic would be on women, children, and adolescents. Of course, we were hearing many concerns already, and obviously hearing that while the disease itself doesn't target women, children, and adolescents directly, the indirect effects can be very serious. Unfortunately, forecasts have been becoming reality, and so we read now of the increase in levels of gender-based violence. We read of the disruption of essential health supplies, including of contraceptives, meaning that many girls and women are put at risk of unwanted pregnancy. And we see how, as health systems have struggled to respond to the pandemic, the coverage of a range of essential services for women, children, and adolescents has been reduced. All of these adverse trends impact on mortality rates, which we've fought so hard to get down for women and children, and also impact broadly on their health and well-being. But alongside this rather bleak readout and period we're going through, we've seen some rays of light, and those rays of light are seen in the leadership of women. Many women leaders have been rightly praised for their effective management of the pandemic. And today we're sitting with distinguished women leaders, past and present. We want to learn from them about the roles they've played and are playing, and also to get their advice on how we can strengthen accountability for women's, children's, and adolescents' health. So, panel today includes leaders from government, the private sector, and civil society from around the world. They are Her Excellency President Kersti Kaljulaid, President of Estonia and co-chair of the high-level steering group for Every Woman, Every Child. We have Her Excellency Saleh Work Zuda, President of the Federal Democratic Republic of Ethiopia. We have Her Excellency Ellen Johnson Sirleaf, former President of Liberia and a Nobel Peace Laureate, who's now a co-chair with me of the independent panel for pandemic preparedness and response. We have Congresswoman Barbara Lee, a forceful and progressive voice in the US Congress, dedicated to social and economic justice, international peace, and civil and human rights. We have Shukti Anantha, a passionate youth advocate for adolescent health from India and a member of PMNCH's Adolescent and Youth Constituency. We have Naina Subawal Batra, CEO of the Asia Venture Philanthropy Network and a recipient of Asia's top sustainability superwoman by CSR Works in 2019. So we're going to go to the first round of questions, and I'm going to start with President Kaljulaid, who must leave after round one. And the first round of questions I will ask each in the order I just set out. Tell us about your understanding of accountability from a gender and equity perspective. Accountability tends to mean different things to different people in different cultures. So what is your understanding of the term? How could accountability for women, children, adolescents be improved during the current crisis? So, Your Excellency, President Kersti, you have the floor.
Hello, Helen, and hello, everybody else. I'm really happy to be with you, and it was very uplifting to listen to the song by Nazem. And indeed, Helen, you are so right. We are missing our United Nations General Assembly gang so much. Accountability of women's, children, and adolescents issues for me mostly means that we mainstream this problem. We mainstream this issue, and we keep always in mind when we are dealing with conflict resolution, of course, when we are dealing with developing the health systems, of course, but also when we are dealing with economic issues. because after all, women and adolescents and children can greatly be helped by development in economies, development also in technologies. And what I believe we have learned from this COVID-19 and the world which is emerging during this pandemic is that the only thing which can help us when we are physically distanced from each other is the more widespread use of technology. And for me, I have been long advocating that in order to understand where are our children and our adolescents and also, of course, women, we need better registries, better public registries of all countries available. And these registries nowadays don't need to be created on paper with pen. They don't need to be created by people going somewhere and registering the birth of a child. It can perfectly be done without any physical contact and any physical linkage. It's absolutely fantastic what technology can do also in the least developed nations, because as we know, mobile telephones are sufficient to provide information if it is available to the public registry about a baby born, a baby in need in vaccination and so on. And I think we should actually promote more when we are talking technology, not abstract things, but very concrete things, which for me would be, first of all, finding the weakest in the society. We do not know who they are. We do not know where they are. All the problems of child trafficking arise from the fact that our people are not in any way in some countries registered and taken into account. We cannot find them when they are lost. And I would strongly advocate to having a better system of keeping track of our children. Otherwise, we cannot save them. This is one issue which I would like to say. Another area where I see we could mainstream women's issues is thinking how technology is changing our job markets in general. Because we know that you can work from afar. You can work from, let's say, Tunisia, your own home room, as a bookkeeper in Estonia. Actually, this has been possible for 20 years. I remember 20 years ago at the turn of the century, when Estonia was, among emerging nations. Nowadays, it's a rich nation, but then it was an emerging nation. And we had already then people who were working for Nordic companies from afar. But for that, you need a legal space which will allow for this kind of development, that women could work from afar, from home, that adolescents could learn to become then adults working from afar, from home. And I would like to point out these elements as the most important issues which you should take as positives from this virus crisis. We have also seen our reports on how the world has been changing and what EWEC goals have been achieved and where we have had fallbacks. For example, we have less vaccinations nowadays than we had already some time ago. We also do not have, for example, a network for midwives globally who are working in remote areas totally alone. They would actually deserve, and I believe they would use actively, a global forum of such midwives. This could also be created by UN bodies or somebody else in order to provide an opportunity for these women to bond, to have somebody in the similar situation to talk to, and also to share the tips and tricks how they could work better in the conditions which, according to developed standards, are never good. They are very lonely, they are remote, and we should take them together using also technology. So you see, you could mainstream the women issues into many, many areas of our life to make sure that women, children, and adolescents are better protected. I think that is enough, Helen, for introduction. And if you so wish, we could do also follow-up questions. Thank you.
Thank you so much. And I know Estonia is very forward-leaning on ICT. And you've rightly pointed out how crisis can be the mother of innovation. And technology and ICT are really coming to the fore in so many ways in response to COVID, but not yet on an equitable basis, which is something we need to consider. Let me bring in now Her Excellency, President Saleh Work Zuda from Addis Ababa. Welcome so much, Madam President, and please come in and address this issue of accountability, what it means, gender and equity perspective. How can we improve it for women, children, and adolescents? The floor is yours.
Thank you very much, Helen. So good to see you, though far away, but greetings from Addis Ababa, Ethiopia, to all of you. No doubt the pandemic has overwhelmed health systems across the world and crippled the global economy. You can imagine how difficult it is for most of us in the developing world. How to guarantee the right to health for all, including women, girls, and adolescents, of course, is indeed a major challenge of our time. As you all remember, only 5 years ago, world leaders pledged to leave no one behind by agreeing to the ambitious and transformative goals towards the sustainable development for all. In the face of the unprecedented challenges that we face today, that now seems to be a distant dream. In fact, the recent report of the Secretary General, it provides a damning reflection on the state of progress towards the SDGs. According to this report, it's not only that the world is on track to meet is not on track, in fact, to meet the SDGs by 2030, but progress has either stalled or even been reversed. So indications are that COVID-19 pandemic has pushed some 37 million people into extreme poverty, a majority of them in our areas in developing countries. We have a particular challenge before us in this regard. How do we prevent women, children, and adolescents from falling into this extreme poverty? Unfortunately, what we see now is actually the reverse. So you have asked me what accountability, in fact, means to me. Accountability is making good on the promises that we have made to women all over the globe. Accountability is finding innovative ways to still deliver on the promises regarding maternal, newborn, and child health. But accountability, we always see it as a responsibility of government, but it's also citizens' action. It's not the sole responsibility of one group, decision makers, but also citizens, starting from households, communities, and other sectors of our society, grassroots organizations, multilateral organizations as well. Do not forget, we have said it time and again, we are in this together. Thank you.
Thank you so much, Madam President, and for specifically reminding us of the impact of COVID-19 on the SDGs. They were struggling a little prior to COVID, and now to see, as you say, the growing numbers cast back into extreme poverty, also extreme hunger, the out-of-school children, and then the health indicators that we as a women, children health constituency are so conscious of. So thank you so much for making those points. Can I bring in now Her Excellency, former President Ellen Johnson Sirleaf, Africa's first elected woman president, and one who gave such effective leadership during the Ebola outbreak in West Africa in her country. President Sirleaf, are you coming in now?
My greetings to all of you. There can be, am I muted? I'm seeing a notice on my screen that says you are muted by host. Am I okay? You hear me? All right, okay. There can be no greater cause, no greater undertaking.
I hear you, Ellen, yes.
Is everyone hearing me? You know, I'm in West Africa where we know the internet is not reliable. So if you hear glitches and interruptions and all of that, please understand. But I take it everybody hears me now. All right.
So we hear you in New Zealand.
Okay. No, I was just saying that there can be no greater cause, no greater undertaking than that relating to women, children, and adolescents. And so whatever we do will have an effect on them because they find themselves disproportionately served by all laws and policies today. Now, accountability for me, simply put, is compliance with rules, laws, regulations, systems, ensuring honesty in words and deed in whatever one does in their responsibility. More importantly, I think, earning the confidence of those who are served by the functions and responsibilities you carry out. I certainly faced the confidence issue when I battled with Ebola, and those who questioned me most when we took a wrong turn of introducing militancy in our response were women who felt in that period of time that we had not done anything to protect them. Clearly, it was because they did not fully understand the intensity of the virus and the responses required. And for all of us, myself included, this was something new. This was an enemy we did not know and did not recognize. But clearly, to get that confidence, we had to admit where we went wrong. We had to correct it. We had to hold them to working with us through consultation and taking responsibility in the areas of communities to restore that confidence. And when we finally were success in resolving our Ebola issue, I must say, women were those who came forward to say how pleased they were that there was a woman leader in charge who could go through it all and come out successfully and create the success much sooner than anyone had expected.
Thank you, Ellen. And such wise words. And my recollection watching what happened in your country was that a turning point was reached when the civil society were engaged, the women were engaged, the youth were engaged, and were able to be part of the response and play a meaningful role. And you created the space for that to happen and to turn the tide on Ebola. So I think your wisdom at this time is very greatly needed. Thank you so much. Let us go from current and former presidents to Shukti Anantha in India, who is a passionate youth advocate. And Shukti, you tell us a little about what accountability means to you.
So it's an honor for me to be able to share the panel today with so many esteemed world leaders and be the voice of the youth on such a global platform. According to me, accountability means holding the government responsible by questioning them on the implementation of programs and policies that fulfill basic rights and necessities of a particular stakeholder, which would be important in the proper functioning of the society. We could always start off by focusing on the main areas of concern in women, children's, and adolescents' health, that is, mental, physical, and social well being. Understanding the various schemes and programs that highlight the rights and entitlements for women, children, and adolescents is essential in this regard. I have personally participated in a few initiatives at my country level which are related to advancing accountability for adolescent health issues. My understanding of accountability also stems from them, and I would like to share it. So, first, my engagement with an initiative by the YP Foundation in collaboration with India's Health Ministry is to develop recommendations for the National Adolescent Health Program through a series of youth led consultations across the country. I analyzed adolescent health issues at my state level and contributed to the recommendations. I'm actively engaged in the follow up process of the same at my state level as well as at a national level with the support from the Policy Working Group STEPS, which is a network. Second is an initiative supported by PMNCH to advance adolescents' participation in adolescent health programming and accountability. In collaboration with the Ministry of Health, an adolescent health advocacy toolkit has been developed, and I'm trained as a master trainer leading on rolling this out. Now, I intend to train few of the peer educators like students and youth leaders who are affiliated with the Adolescent Health Program as a pilot initiative. Third is an initiative by the Policy Working Group STEPS, where needs assessment on adolescent health issues was conducted across the country during the COVID-19 related lockdown in India and gave recommendations to the Health Ministry and WHO for needful action. I contributed by sharing the challenges faced by school students and also contributed to the recommendations, especially around adolescent mental health. One of the positive developments has been the initiation of a pilot intervention by the Ministry of Health, supported by WHO India, on psychosocial well being and mental health of adolescents. I am a part of the initiative, which is to create a cohort of first responders to their peers. India has created an India's Women, Adolescent, and Child Health Strategy in 2018 in accordance with the global strategy, which means that the country is committed to take positive action to advance women's, children's, and adolescents' health in the country. There are global frameworks of SDGs, World Health Assembly resolutions, and human rights frameworks which mandate the country to advance adolescent health. All these frameworks accord adolescents like me with opportunities to assess and ensure adherence to these commitments. I strongly believe we can strengthen our voices on women, children, and adolescents' health by analyzing and highlighting the challenges faced by us and hold our governments accountable for adequate action on these critical issues. Thank you.
Thank you, Shukti. And your statement makes it absolutely clear beyond doubt why governments should engage youth and adolescent constituencies on these issues. You offered so much by way of perspective and constructive comment. Thank you very much. Let's zip now around the world to the United States of America and to Congresswoman Barbara Lee. Barbara, please come in on accountability.
Well, hello all. Good to see everybody. It's an honor to be with you. I've met many of you over and over again throughout the years, and I just want to thank all of you for your phenomenal leadership and mentorship, and really making sure that women are central to each and every policy in your country, at the United Nations, throughout the world. You know, I'm in Washington, D.C., so I bring you greetings from Washington, D.C., but my district is in Northern California, so I bring you greetings from Oakland, California, and my congressional district, which also includes Berkeley. Accountability really is fundamentally about power. It's a question of who is obligated to whom. And in a functioning democracy, it essentially means that those in power have an obligation to serve the interests of everyone, and that means women, children, and adolescents. Now, the core evil in my country of systemic racism and gender discrimination, the idea that those in power, in fact, do not owe any obligation to women, nor to people of color and African Americans, is one of the key issues that we, as minorities in the United States, are fighting for in terms of trying to rid our systems here of racial discrimination and gender discrimination, so that there will be true equal opportunity for everyone, which means for women and adolescents and children. So the way to improve accountability for women and children means helping women claim their right and secure more political power. That includes organizing women in the public sphere through voting, through civic engagement. It also means to make sure that women can band together in a free and robust civil society. It also means giving women more power in the private sector by making sure that the law and that the social norms support women's ability to make choices about their own bodies and their family's future. Also, let me just say, looking at policies as a member of Congress, I have to view my accountability in terms of a racial and gender lens whenever policies are being made, so that I make sure that I am being accountable to women, children, and adolescents. And every person in a position of power needs to do that, because we cannot forget that governments make policies for priorities and develop priorities, and oftentimes don't include women, and it's up to women to make governments accountable to issues that impact women and all issues, because women bring a perspective to make countries and societies stronger. When you look at, for instance, I'm citing one issue, climate change and its impact on women. Women must be part of the solution, and that means, women have to hold everyone accountable for the impact of climate change on women. In the context of this COVID pandemic, one of the real threats is isolation, because social distancing makes some women, unfortunately, more vulnerable to abusive partners. And some children will and are being subjected to more abuse and neglectful adults. And so our children need to hold adults accountable. And we have to have systems in place that will allow young people to do just that. And so we'll be working much harder to make sure that women and vulnerable people during this period get the support that they need. But in doing that, we have to hold, and women have to hold those responsible, if they're not women in power, the men who are there, responsible to make sure that their needs and that they're included in each and every aspect of the response to the COVID pandemic. But finally, let me just say it's extremely important that women run for public office, become parliamentarians. I know President Johnson Sirleaf has committed her life to this as a role model and through her institute. And it's so important that women have a seat at the highest level possible, because then women will have someone who will understand and will be accountable to them. And that is essentially the goal of accountability, in terms of making sure that every woman has a seat at the table in whatever space they work in or serve in. Thank you again.
Thank you so much, Barbara, and also being an inspirational role model of women standing up to be counted and really advocating so strongly as you have just now. We'll come back and talk again in the questions we put. Now, let us come to Naina Subawal Batra. Naina, coming out of a private sector perspective, please share with us your concepts around accountability and how it could be improved for women, children, and adolescents.
Thank you very much. It is indeed a great honor for me to be on this panel with all of you extremely esteemed leaders. I'm here to represent the private sector. I lead a network of philanthropists, social investors, impact investors. And, I want to refer back to something that Her Excellency President Zewde said. Accountability cannot be the responsibility of only the government. It is extremely important that we hold the private sector accountable. I think one of the things that has come out after, post the pandemic is the fact that the richest people in the world have actually grown richer during the course of this pandemic. The fact that over the last decade, we have seen more billionaires being created and more people, especially women, adolescents, and girls being pushed into extreme poverty, into inequality, shows us that it's very important that the private sector is held accountable. We all agree that in civil society, there is tremendous accountability on the part of nonprofit organizations or social enterprises in delivering products to end beneficiaries. I think it is extremely important that foundations, philanthropists, and funders are also held increasingly accountable to demonstrate the impact of the contributions that they make and the contributions that they hold to public in terms of the change that they are trying to drive. If we look at girls, women, adolescents in the post-pandemic, post the COVID-19 crisis, I think one of the things that really stood out to me is that reference to the SDGs. We have seen definitely most of the SDGs have sort of faltered in their progress. But goal 5 is the one goal which actually relates to women, which has moved the least. And that is why it's really important that we see more social investors, we see more philanthropists who pay heed to the growing body of evidence that suggests that empowering women is critical to boosting global prosperity. We are seeing in Asia, and I'm talking to you this evening from Singapore, that Asian investors are backing this trend. We see an estimated 67% of our 600 plus members who have deployed more than $10 billion towards social impact. They have indicated a commitment to women and girls as their beneficiaries or gender equality as one of their primary impact areas. The interest in this agenda extends beyond supporting women as mothers, but also to building the capacities of women so that they are assets to the community and the workforce. Since gender equality is such a nuanced and complex challenge in Asia, our numbers typically converge at various intersections. I think Congresswoman Barbara Lee talked about climate change. We are finding that there is a lot of intersectionality between gender and climate change. We are seeing intersectionality between gender and health, gender and education, gender and economic empowerment, and livelihoods. While we are seeing this engagement towards an awareness around practitioners, I think there is still a huge potential for them to move from intention to action. 2 out of 3 of our members are still at the early stages of building their practice and portfolio in gender lens investing, but they are keen to deepen their engagement in this space. Another 1 in 5 have already applied a gender lens when conducting impact measurement. To bridge these gaps and improve accountability for women and girls, we need to understand what are the barriers in adopting a gender lens into impact at work, and how do we hold the private sector responsible for including this gender lens in all their activities.
Thank you so much for those very thoughtful comments about how the gender lens can be applied to improve accountability in the private sector. That completes our first round, but President Kirsty, I understood that you had to go after the first round, so I might just pop one question to you before you have to run, and that comes from out in cyberspace from Felix Ingwu, who asks, what instruments could be deployed to track accountability and governance to ensure compliance of maternal, newborn, child and adolescent commitments? So I ask you that with your chair of Every Woman, Every Child hat on.
Well, as we discussed this, all needs to start from making sure that we have set ourselves our objectives, and then we are able to measure these objectives. And as far as I know, in the regions where we have most problematic situation with, for example, vaccinations, with helping girls to school, etc., we also have pretty bad understanding who we have as our population, where they are, and what is their actual situation. So we need to make sure that, first of all, we have set objectives, and then we know whom we need to help, and then we have also the system which will measure how exactly these people were helped. It may sound a lot of tracking, but frankly speaking, can you say that this is the biggest problem in the global world? When we cannot help people, when we don't know where they are. Yes, in developed world, we have a lot of problems with safeguarding our data. But I mean, if I put myself in the shoes of a mother somewhere in South Africa, seeking for the closest place to go and vaccinate my baby, I would be very helpful if there were a tool online, which doesn't need to be data dense, which can work on my mobile phone, or a mobile phone, which is the only one in our village, and will give me this information. Because guess what? I've noticed that many people who also migrate towards Europe coming from Africa are totally unaware of the opportunities of their own continent, the opportunities their own government is providing them with in order to kind of uplift their life to a new quality. And I believe, therefore, that, I mean, using the technology we have anyway, which also has high penetration rates in less developed countries, we have seen it. Who has traveled has seen, I mean, that many people command actually a certain level of technology also in faraway places. We should harness this. And then set clear objective, measure against these objectives. Thank you.
Thank you so much. And please, when your commitments take you away, we thank you, and thank you for being with us so long at the event. Now, I'm going to come to a round of questions, and we're going to need to be fairly disciplined about our length of answers. I have 2 for each, and I'm going to stray a little from protocol and change the order of the speakers. So I'm starting first with Barbara, Congresswoman Lee. Barbara, when we look at progress on improving health outcomes, it's apparent it's very unequal, and more needs to be done to reach the hardest to reach first. We see COVID-19 casting really a light on inequalities within the United States of America, including on the basis of ethnicity, where different communities have been impacted very differently by the disease. That follows on from other findings, like, for example, that African American women in the USA are 4 times more likely to die than their white counterparts while giving birth. What would you like to say about these disparities and how they can be addressed?
Thanks so much, Helen, for that question. First of all, we have to remember the historical context. African Americans were brought to America 401 years ago and enslaved for over 250 years. Subsequent to enslavement, we had systems established to re-enslave African Americans in a different way. We had black codes, we had segregation, we have mass incarceration, we have discrimination in housing, and you name it. And so building upon that, unfortunately, we still have the manifestations of the last 401 years. So we have systemic racism, which is at the core of these disparities. And so we've seen clearly in the United States how Black people have been more severely impacted by the COVID-19, for example. Black people are dying 2.5 times the rate of white people in the United States. So far, 39,200 Black people have been confirmed to have died from COVID, more than 1 out of every 5 of COVID deaths in America, yet we're 13, 14% of the population. Indigenous and Latinx people are also suffering disproportionate rates of infection, each being 50% more likely to die from COVID than white Americans. And so some of this is a legacy, most of it is a legacy of unequal access to quality health care. In the United States, we have resisted training healthcare or treating healthcare as a basic right, a basic human right forever, meaning that healthcare is in many respects tied to whether or not you have money or not. Racism plays a role. The underrepresentation of African Americans in medicine has created systemic discrimination in healthcare, even before this pandemic. Black and brown people in America face persistently bad health outcomes, the result of a range of social determinants. And these social determinants include cultural barriers, environmental injustice, economic inequality, lack of access to health insurance, and quality health care. And it also has created a distrust of the health establishment among African Americans. This mistrust is so prevalent that it's been documented by the National Institutes of Health. Another factor, of course, is the unequal economy, which forces poor people, low-income people, and there's a higher percentage of low-income people and poor people who are African American into jobs where they can't really isolate or distance and where they're more vulnerable to the virus. And many more of these people forced into these essential jobs, they're women, especially African American women and women of color. And so the power shift that we need is both political and economic. And we need to start catching up with the rest of the industrialized world and making equal access to healthcare a basic human right guaranteed by the government. Finally, I'll just share with you as it relates to maternal mortality. When I was born, my mother needed a C-section, cesarean section. She was denied admittance into the hospital because she was Black. My mother almost died in childbirth because it was too late when they finally let her in to have a C-section. And this was years ago. I barely got here. They had to rush my mother into an emergency room, and they had to use forceps to deliver me. And I had a scar above my eye until just a few years ago. Now, having said that, here we are years and years and years later with African American women still dying in childbirth, 4 times that of white women. And so this is systemic in our country. And so it directly relates to the correlation of systemic racism, which still we've worked on, we've come a long way, but we have a heck of a long way to go. And it definitely is seen now as a result of the COVID pandemic and how women and who are essential workers who are Black and brown are contracting the virus and dying in larger disproportionate rates.
Barbara, looking from afar as we do at the situation, we see the number of COVID-19 cases in the USA continuing to soar. We see very considerable social unrest. But out of this, does there come an opportunity to confront these inequalities, long-term entrenched inequalities and determinants that you're talking about?
Yes, and I say thank God for the peaceful protests that are taking place because finally people who didn't understand what Black Lives Matter means now know what Black Lives Matter means. And it's thanks to our young people who, after the brutal, horrific murder of Mr. George Floyd, everyone in the world saw that and saw what we've been dealing with in this country for the last 401 years. So yes, I think that now the protests are forcing this democracy to wake up and to realize that this real reckoning in America has not occurred. And so as a legislator, what I'm working on right now, which many countries have worked on, the United States never had, a Truth, Racial Healing Transformation Commission. I believe over 40 countries have had some form of that. And we want to put into historical context through this commission why you see Black people dying disproportionately, why you see African Americans who are incarcerated at rates that are way past the population, why these manifestations of systemic racism have to be dealt with upfront, such as other countries have done. And then you move toward healing and transforming this country, which means developing policies and programs that have racial justice at its core, because at its core right now, the DNA of America is systemic racism. And so that, along with another bill, HR 40, calling for a commission to look at reparations and to develop reparations, are two of the pieces of legislation that we believe will move this country forward to begin to address systemic racism finally, once and for all. And the young people in the streets and the protests have really helped garner support for this, because so many people, even in my progressive congressional district, which is a wonderful, enlightened coalition intersectional district, couldn't quite figure out why they saw on television so many African Americans dying, and didn't relate it to 401 years ago of the beginning of bringing enslaved people from the continent of Africa into America. And so we've got a lot of work to do. We've made a lot of progress. Thank God for our brother, beloved John Lewis, and our civil rights leaders and our human rights leaders, the Black Panther Party, which I was a part of in terms of a community work. We've had many, many, many protests for racial justice, but we've never gotten to the core, and that is how you break the chains of slavery. And so this hopefully is that moment for the truth-telling moment for America to move forward.
Thank you, Barbara, for sharing on that and highlighting the role of the young people as well. And that brings me back to Shukti, because Shukti, we see youth around the world demanding meaningful youth engagement, and in the health sphere, we see it manifesting as young people wanting a say in matters that affect their health and well-being. Now, you are in a country, India, with a very large adolescent and youth population. I understand India will continue to have one of the youngest populations in the world until 2030, the SDG date. So what measures could be put in place to ensure that the voices of the youth are heard?
So thank you for the question. And it is indeed a crucial issue. At the moment, the population of the youth is commonly misunderstood as a healthy population and are undermined from getting the right kind of attention or basic needs that they find necessary. Often their ideologies are sidetracked and neglected. So we as adolescents and youth are often driven to contribute to society with free labor without our opinions being incorporated and thus our rights not fulfilled. Often we are not given a chance to be involved in the decision making process. And when we are, it is usually tokenistic. The right kind of engagement would encourage the youth like us to hold the governments accountable, have equal rights as any other adult to voice their concerns, and inform programs and policies to bring positive change to the society. In spite of a few platforms such as the PMNCH's Adolescent and Youth Constituency and the AAHA guideline, which is rolled out in certain countries, there aren't many formal avenues for adolescent participation in adolescent health programming. Like I shared earlier, consultation processes to inform the adolescent health program in India needed to be initiated externally to enable us to give inputs. And even after so much effort, there are no opportunities for holding the government accountable for forward action. I do hope such mechanisms are institutionalized within government systems, which also embed youth led accountability. The COVID 19 pandemic has stalled the active engagement of youth and has shrunk the avenues even further. Young people are forced to use the digital platforms as a mode to get important issues to the limelight, which comes with its inherent challenges of access and equity. In absence of the possibility of in person meetings, the government should leverage the virtual platforms to engage with youth and adolescents from different parts of the country with relative ease. Adolescent health programming aspects have been deprioritized in most parts. There is a pressing need to look at youth and adolescents with an intersectional lens in order to identify the concerns of this huge and heterogeneous group and take a leave no one behind approach. Without understanding the perspectives of the youth and adolescents, it is impossible to expect any sort of effective change in the adolescent health spree.
Yes, and I think the cry of youth is no decisions about us without us, and I think we can count on you and your peers to be holding your government very much to account. Let me come across to Nina again and the role of the private sector, and perhaps comment a little, Nina, on what needs to change to enable public and community health actors to work more effectively with the private sector, particularly around achieving in this health SDG area and in the areas of women, children, adolescent health.
I think we had Madam President from Estonia talking about technology. I think that is one place where the private sector can really work together to deliver health outcomes. In the continent where we are active in Asia, we find that last mile delivery of health is severely lacking. And working with the private sector, using technology, using digital platforms is a way for policymakers to actually bridge that divide. And it's interesting. Johnson & Johnson, a large healthcare company, actually did a global competition to talk about how you could deliver health outcomes to women and children. And one of one of the winners, in fact, was very interesting. They had a wearable technology that actually tracked migrant workers who delivered children where they were far away from a health, a centralized healthcare center. And this wearable technology actually, without having access to internet, tracked milestones in the infant's birth. Now, this is an example of how corporates can actually work with social enterprises to actually help scale that technology and make sure that it gets to the people who need it the most, to the women and children who need it the most, because corporates have distribution systems, they have the capital on hand to actually take that technology further. The question, however, is, do corporates do this for their own profit? Or how do we actually hold them accountable that they are actually delivering a product for community? And that is where it's important that government partners with the end consumer to actually hold corporates to account, to say that this is something that you are doing for the greater good. We have found post-COVID a lot of captains of industry talking about building back better, talking about the fact that it has to go beyond profit towards purpose. It is now, I think, our responsibility, each and every one of us, that we hold industry to this, that we look at profit, which is more purpose-driven, and look at a true triple bottom line.
Absolutely. Thank you. Thank you so much. President Sirleaf, reflecting on what's been said on the way in which women leaders, including you yourself during the Ebola epidemic, manage during crises like these, what do you think governments need to do to manage the pandemic better in ways which respond to the needs of women, children, and adolescents? And do you think in the process of the review independent panel that it could bring to light some of the issues around the gendered impact of COVID on women, children, and adolescent health? And now we need the mute button off. Right.
Okay. Are we okay down? Okay.
Yes.
As I listen and reflect upon 12 years of what I like to think was a successful presidency, I just conclude we have so much more to do. We've missed quite a bit. And I just hope that COVID-19 that has really reached into every country and exposed every weakness can really become that wind of change, can really address all of the inequities and the injustices that we have faced, that others have faced. I look at the result of COVID-19 in Africa, particularly in my country and in area, and we've been in a way able to control the transmission, perhaps in part using our experiences from the Ebola epidemic. But still, there's so many of our countries with deficiency in infrastructure and communication that will not reach many of those people in rural areas, will not reach communities with high population that have no means of doing social distancing. And as we move into the areas of vaccines, we know there's going to be competition for it, and resource deficient countries will be left behind because they will not be able to buy the vaccine. And so how will we create the conditions in which equity for all? We talk about it, leave no one behind, make sure that no one is safe until everyone is safe. But we need to find a means to carry those words into action. I look at some of the things that Barbara said, and I just have to say that the consciousness that we have now as a result of the experiences of Roy Thomas and all of those tell us there's so much we need to do to connect in this world, so much we need to network, to exchange ideas, to recognize the failings of ourselves and find a means to address it. How do we, what else can government can do? Listen to the people and show that there's a compact. Listen to the voices of the children, because in our area, Africa, our population is young, and tomorrow they are going to be the leaders. And if we do not prepare them for that leadership that they have to take, then we're failing ourselves. So there's much more policy-wise that one can do, changing the laws in order to break the stereotyping, in order to improve the rights of women, access to education, access to the factors of production and all of that. But until we can put this in a global framework of leadership, willing to take those into implementable interventions, then all the laws and policies we can make can amount to very much in terms of impacting the quality of life and the differences that we have in those who continue to suffer from inequalities and injustice. And those are mostly women all over the world. So when it comes to the report of the IPPR, I just think that we will dig deeper. Those who are doing the assessment, being able to find out the causes and effects of COVID-19, will come up from findings, recommendations that address these inequities that have existed throughout our world, and will give leadership to the women who have excelled in the responses, and those who not only carry the burden but continue to be the voices of reasons and the voices of calls to action. And so I hope that our report, Helen, will will bring more consciousness, more awareness, and perhaps more action from the leaders of the world.
That's our aim. Thank you so much. President Saleh Work-Zuda, President Johnson Sirleaf referred to the issue of resources. And we know that money's never everything, but it does help a lot when you're trying to deliver services and pursue development. As the crisis plunges countries into recessions, that affects the level of domestic resource mobilization and, of course, of international funding. So you have the double whammy, rising costs for health and social services, less money to do it with. How do you see countries continuing to deliver services in the face of these constraints? And bearing in mind we've had a contribution from the private sector, what role do you think it can play to help in the lower and middle income countries in this context?
Okay, thank you so much. I fully agree with what President Sir Johnson said. The issue of financing is one of that every country is experiencing, especially those of us in the global south. Since the beginning of the pandemic, in fact, many local and international resources, both financial and human, have been diverted to the urgent COVID-19 response. This has caused major gaps in the provision of basic health services for women and children. The maternal, newborn and child health as well, and other services have suffered in light of budget and personnel constraints. Like in everything, we really had to strike a balance. As soon as the first case was diagnosed here in Ethiopia, the government issued a guideline to all regions so that we're 100 plus million here in Ethiopia, so that non-COVID essential health services are not overlooked as much as possible with the weekly monitoring system. So in what we should do, really, let me focus on 3 points. One, we must do everything in our power to promote a prevention-first strategy when it comes to the COVID response. Most countries, even those with robust health system, really have been struggling to meet the rising need to care for COVID patients. So I think the prevention is very important. I hope that you have succeeded in respective countries. It's rather difficult to impose some of the measures on people so that they could prevent it. Second, I think it's very important that we come up with innovative and homegrown solutions, homegrown ways in addressing these issues, because there is no one size that would fit all of us. In Ethiopia, you might know that we have a good experience in terms of our health extension workers, 42,000 of them, and nearly all of whom are women, are conducting, a substantial amount of our COVID related screening, contact tracing, as well as, awareness creation efforts. This type of out-of-the-box thinking is exactly, I think, what is needed. Before COVID, these extension workers were conducting routine community health education and basic treatments and procedures. With some training, we were able to use them to use our unemployed women as change agents within our communities. And third, the last point would be, whatever resources one country has to complement national efforts. Sometimes it's presented as if it was the primary source of all this. Domestic resource mobilizations will be more predictable and sustainable. It should be given a priority, and we're trying to do that. The key here is to limit the impact of the pandemic and use the unique resources that you have at our disposal. On the private sector, I really think, we really think here in Ethiopia that it's very important. The role of the private sector has not been very visible in the past. It has not been a major player in our country. But I think it's very important that we have this partner along with the government efforts. We have encouraged our manufacturers, for instance, here to divert their production in producing what is much needed for this pandemic, with a win-win kind of an arrangement, and stuff that were in short supply globally. So they were engaged in producing PPEs, laboratories, hospitals, and so on, privately owned, have been also used. I think the major way that I think we have to increase the investment in the health sector and encourage our private sector to do so. And I'll conclude by saying the government has a big role in that, in creating the conducive environment, promoting access to finance, and investing in human capital, passing conducive regulations, and promoting access to and use of technology. I think there is a good place for the private sector in this context. Thank you.
Thank you so much to the wonderful panel with the voices of wisdom from experience in government, experience in Congress, the input of youth from the private sector. No one size fits all, but there's a lot of experiences you've all shared for many to draw from. PMNCH has asked me to say that, of course, they have a number of tools which are very helpful to partners in looking to advocate for and put the case for women, children, and adolescent health. And they're going to put those links on the chat function that participants can see. And also a link to the call for action that was made in July at the first Lives in the Balance Summit, where we call for a prioritization of the needs of women, children, and adolescents, which, after all, as a population demographic, make up at least 2/3 of the world's population, so not insignificant. So let me thank all the panelists. We've run a little bit over, but you've all had such wonderful, interesting things to say. And thank you for making time for the PMNCH Accountability Breakfast. I think I hand back over to Mercy. Thank you. Thanks all.
Wow, what a power session that was, and that hour went by so fast. Thank you very much, Right Honorable Ellen Clark and Your Excellency, Honorable President Kalilai, Honorable President Zude, Honorable former President Ellen Johnson Sirleaf, and Congresswoman Barbara Lee, Shukti, and Naina. It was truly an honor to learn from you and to have your participation during this program. And, it is a fact that in many of our countries, lack of women's representation just, undercuts an inclusive response. And I hope that just from listening to those power women speak, we realize that we need a leadership that is more collective than individual, more collaborative than competitive, and more coaching than commanding. And I really, really appreciate all of you, our audience that has been super active on social media and on chat. I really loved all those comments coming in, people talking about us harnessing the wisdom, intelligence, and lived experiences and ideas of young people like Shukti. And that was Kerry Jones. And then, people talking about we cannot separate politics and health and how silence divides and conquers us. So thank you so much for, all those conversations. And in case you were wondering, we very much welcome men too in this conversation. And, we have some of them, actually many of them, who are actively fighting for the health and well-being of women, children, and adolescents. And on that note, there are really fantastic video interviews that we have done with some of the men I'm talking about on the Accountability Breakfast website. You can go and sample them out. We spoke to Dr. Victor Giorgio of the Inter-American Children's Institute, Dr. Howard Taylor of the End Violence Partnership. And we also have Mr. Darren Wild's interview. He's the head of policy for the UK's Foreign, Commonwealth and Development Office. So take a look at all those videos. There are a ton of resources in that website that you are in. Now, before we move to the next session, would you just please let us know what you thought of that first part of the breakfast with the women leaders? And this is a poll, so you can scroll down to the poll section of the website and rate the session that has just ended by clicking the choice that most accurately reflects your opinion. So you have two options: a sad face, whether to give us a sad face if you did not enjoy this session, or a happy face if you really enjoyed this session. So please let us know what you think. And also just a kind reminder to keep the conversations going on chat in the website and on social media. Our hashtag is #AccountabilityMatters, #AccountabilityMatters. Please feel free to tag the hosts who are actively on Twitter under the handles at PMNCH, at WRA Global for the White Ribbon Alliance, and at UN_EWEC, UN_EWEC for the Every Woman, Every Child. Now, our next panel takes us from politics to evidence. Basically, what do the numbers tell us about where we are at in the struggle to protect the rights of women, children, and adolescents? And more importantly, how can these data shine a light on the most important things we need to do together? Every Woman, Every Child has just launched its 2020 progress report on the global strategy for women's, children, and adolescents' health. And it is entitled Protect the Progress, Rise, Refocus, Recover. The report can be accessed from the resources section of this website. And this next session will just take us into a deep dive of the report's data and highlight gaps and challenges that the global community must urgently act on, must be accountable on, to guide global and domestic investments in sexual, reproductive, maternal, newborn, child, and adolescents' health. And again, before we move to that session, I have another poll for you because we really value your participation as our audience in this. Unfortunately, we cannot have the 1,500 of you on screen and engage all of us. We would take days. So the polls of the charts are one way we are engaging you, and we're just asking, what is the one word that describes the biggest barrier to ending preventable maternal, newborn, child, and adolescents death and stillbirths? You can answer this in response to, in connection to your country or, globally, or just what you feel as an individual. What is that one word that you feel describes the biggest barrier to ending preventable maternal, newborn, child, and adolescent death and stillbirths? I don't know if you have started giving us the responses ready, but if not, I will sample some of your responses shortly after we have a look at this video that just takes us through the 10 years of Every Woman, Every Child, and it is narrated by the UN Deputy Secretary General, Ms. Amina Mohammed. Take a look.
While women have been among those most severely affected by the crisis, women have also been among the strongest and most decisive leaders in the response. Global solidarity will be crucial.
For the past decade, Every Woman, Every Child has been a tireless advocate for the health and well-being of women, children, and adolescents all around the world. Impressive progress and commitments have been made. We're seeing fewer girls are married off as children. We're seeing fewer mothers and babies are dying. More children have access to life-saving interventions than ever before. But just as we commence a decade of action, embarking on a 10-year journey to achieve zero preventable deaths amongst women, children, and adolescents, the COVID-19 pandemic has threatened to unravel decades of progress. Millions of children and adolescents are losing access to vaccines, and millions of women are losing access to contraception. Gender-based violence is back on the rise. Now more than ever, it will be imperative to come together in solidarity with a unified voice of urgency for more action. Through committed and collaborative organizations and leaders, through expert analysis and knowledge sharing, through innovative solutions that work for those most in need, leaving no one behind, and for services that reach people wherever they are. This unprecedented moment can be more than just a period of survival. It can be transformative. It is time for us to deliver for every woman, every child, and every adolescent.
Indeed, now more than ever, as the UN Deputy Secretary General, Ms. Amina Mohammed says, we need a unified voice of urgency and more action. This is the only way to achieve the goal set for the decade of action. Up next on the virtual stage, please let's all welcome Jennifer Rikeho, a senior advisor in the Data and Analytics Unit of the Division of Analysis, Planning and Monitoring at UNICEF headquarters. And Jennifer is the lead writer of the Every Woman, Every Child at 10 report. So today she's going to introduce the report and its major findings, and then we will take it up with the panel after that. The floor is yours, Jennifer.
Good morning, everyone. I'm here to present to you today some of the top findings of the Protect the Progress, Rise, Refocus, Recover, Every Woman, Every Child Decade report. My name is Jennifer Rikeho, and I'm based at UNICEF. This report is meant to be a celebration of the past decade and a look forward to the next 10 years ahead. So starting off, these past 10 years since the Every Woman, Every Child movement was first launched have been a time of great progress for many of the world's women, children, and adolescents. Before the pandemic was declared this past March, deaths for children under the age of 5 reached an all-time low. Maternal deaths have dropped by around 35%, and we also saw great increases in coverage of essential interventions for women, children, and adolescents, some of which reached over 80% coverage. And also there was a huge increase in political commitment to women, children, and adolescents that resulted in 776 multi-stakeholder commitments and over US 186 billion to improve the lives of women, children, and adolescents. However, a lot of challenges were still present even before COVID came into our lives. So these are around the areas of inequities, climate change, and conflict. We still had in 2019, 1 million adolescents and 5.2 million children dying from preventable causes. Every 13 seconds, a newborn baby died, and every hour, 33 women did not survive childbirth. We still have a situation where birthplace and wealth status play a determining role in how well women, children, and adolescents will do in terms of their survival, their ability to thrive, and their ability to reach their potential. We have a growing concentration of mortality in sub-Saharan Africa and South Asia. We also know that there are many women, children, and adolescents that are living in countries affected by conflict, and they are much more likely to experience higher rates of mortality and lower levels of access to services, including education, health, and social protection. And we still have this looming climate change threat that we must address for the future and for our current generation of children, adolescents, and women everywhere. This slide is just meant to emphasize the point of inequities in coverage of interventions. What we're seeing here is that women and children in the lowest wealth quintile have much lower coverage than their wealthier counterparts. Turning to COVID-19, the potential impact, there are 3 main pathways through which COVID has had a negative effect on women, children, and adolescent lives. One is through the disruption of essential services. The second is that we're entering into a global economic crisis, which has increased levels of poverty and hunger and reduced people's ability to pay for food and healthcare. There's also been massive school closures that have had a very negative impact on children and adolescents, and a surge of incidents in domestic violence. This slide is just meant to show you the number of services that have experienced disruptions in many countries around the world after the COVID pandemic was declared. However, this decade ahead of us is one that has a lot of hope, and we still can work together to achieve the vision of every woman, every child. Some of the main ways in which this can be achieved is emphasizing the power of partnerships. So that is part of the reason why we are gathered here today, is to, again, think about the role of partnership and multilateral action in driving accountability for women, children, and adolescents. Also, we need to garner more support for the 3 pillars of the primary healthcare model. This includes emphasizing different ways that we can emphasize multi-sectoral coordination across the health, social protection, WASH, agriculture, and other sectors. In terms of improving the delivery of healthcare services, there must be a continued emphasis on improving the quality of care and also shoring up health information systems. The COVID crisis has made evidently clear the need for really strong health information systems so that countries are able to manage emergencies like COVID, and also to regularly monitor their health services so that they can better plan. We also need to emphasize the importance of increasing citizen engagement and community empowerment. Through this, we can have people more involved in the development of policies and programs that address their needs, and also have people be able to play a stronger role in holding their countries to account for delivering the services that they deserve. I want to thank you all very much for paying for your time, and I wish you the best for the rest of the accountability breakfast. And also, for more information, please visit the microsite where the report and a bunch of other associated.
Thank you for that very detailed brief of the Every Woman, Every Child at 10 report, Jennifer. Brilliant work unpacking, the last 10 years for our audiences. And the take home for me is these 3 words: protect, refocus, and recovery. How urgently do we need to protect the progress, refocus our efforts on women, children, and adolescent health, and steer the recovery towards a more inclusive and sustainable future? So thank you very much, Jennifer. And we asked you a question about, one word that describes the biggest barrier to ending preventable maternal, newborn, child, and adolescent deaths, as well as stillbirths. And the responses are coming in. You are talking about, non-accountability, corruption, ignorance, implicity. There's, the politicians. I think that means bad politics. And then there's bias, lack of solidarity, inaccessible governments. And then somebody said poverty, somebody said disinformation, somebody said capitalism. And, the responses are just so many. And thank you so much for, telling us all this. This is what you feel is the biggest barrier to ending preventable maternal, newborn, child, and adolescent deaths, as well as stillbirths. And these are the things we really hope to unpackage and make our leaders accountable, and even ask ourselves in our individual capacities, just realize that these are the things that are drawing us back. And how do we move forward from here? How do we make the next decade a good 10 years for women, children, and adolescents when it comes to their health and their well-being? And another reminder to our esteemed viewers is just that there are tons of material for you, including interviews in French and Spanish with the Protect the Progress Report authors, including Dr. Teresa Diaz of WHO and Petra Hope of UNFPA. So you can access all this in the Accountability Breakfast website. And at this point, allow me to introduce our first set of speakers for this next session that will look at data and lessons learned from a decade of progress. So first in, Dr. Sabir Pardes, Senior Advisor to the Ministry of Public Health of Afghanistan. Thank you so much for joining us and for choosing to spend the next hour with us. Next, we have Dr. Shannon Haider, Deputy Executive Director of UNAIDS. We have Ms. Heda Vabak, Executive Coordinator of the Scaling Up Nutrition SAN movement. And finally, Dr. Smita Pajpai, who's the Project Director of Chetna, India. Thank you all so much for joining us. And as we go on with this discussion on the virtual stage, just a reminder that we are all part of this deliberation. So please share your experiences in the chat box, your thoughts, and any questions you may have for the panelists too, because Jen, my very able colleague, is out there moderating that chat discussion and will definitely pass all the questions you have. We will sample some of them and pass them on to our audience. Dr. Shannon Hader, how are you? I hope you're well. And you are the first one that I'm going to pose a question to. So thank you so much for coming on board.
Great. So good to be here. Thank you.
Great. Now, you have an impressive track record in providing the strategic, direction and technical support needed to catalyze and connect leadership from governments and communities to deliver life-saving HIV services. Now, let's take a look at the past decade in this space that you have been in, and particularly from the AIDS pandemic. What lessons are you carrying from the last 10 years that you are confident can help us navigate the next decade of action for women, children, and adolescents?
Thank you. And let me actually start by saying, on behalf of the H6 and UNAIDS, I want to congratulate all the partners on this 10th anniversary of EWEC. Thanks to Helen Clark and Helga Fogstad and Vivian Lopez for coordinating this, and of course to the PMNCH, EWEC Secretariat, WHO, UNICEF, UNFPA, GFF on this excellent flagship report. Whew. But you asked a really important question, and I saw in the one-word poll, accountability came up as one of the big words, and what's needed. And I think coming from the HIV response, this is one of the lessons learned. I think three things when it comes to data and action: accountability, country-led systems and specific actions, and community-led monitoring and responses. So in accountability, what we've seen is that's twofold. One thing is big, bold commitments to action, and second is the ability to track progress against those commitments and see where we get to. Certainly in the HIV response, we've seen these big, bold commitments, not only in the SDGs, but in specific high-level meeting commitments on HIV, which is why every 5 years we come out with a new set of targets and get the whole UN General Assembly to commit to them. But we also have special initiatives like the Partnership to End Stigma and Discrimination in all its forms, where so far 18 specific countries have signed on to make measurable progress for discrimination in 6 specific areas. So all types of commitments. But the ability to measure and track results with consistency, with granularity, with transparency, going beyond averages so that we can unpack them to focus on what's going well, but really who's being missed and what's left to do as responses evolve. In the first UN General Assembly commitment specifically to HIV, one of the big commitments was support for some core standardized measures and reporting across all countries. And we now have the Global AIDS Monitoring Framework, where we support countries to review their own data annually, take stock of what's achieved, triangulate with other information on policies and laws and spending, and really be able to allow countries to see themselves where they're at, compare themselves to other countries, and compare themselves to targets. We've seen by doing that, for example, that we've made progress on pediatric treatment. We have bold commitments that 95% of children living with HIV would be on treatment by 2020. And we've seen some success, doubling the number of children living with HIV who are on treatment since 2010. But only because of that age and place specificity, we see what's being missed. We see barely 53% of children living with HIV are actually on treatment. That's well below adults. That is 850,000 kids living today with HIV who are not on treatment. And when we look further, we see 2/3 of those kids are 5 years old and older. So if we think we're just going to find them in antenatal care or in early childhood services, we'll miss them. So that gives us some direction. Second, I think one of the things we've done as UNAIDS is really champion direct investments in the systems and the skills of country teams themselves to collect and use their own granular data, use the results of models that helps create specific program decisions. For example, we have something now called the stack bar analysis for vertical transmission, where we can look country by country or region by region and say, okay, of the kids who are still getting infected vertically with HIV, what's the cause? And we'll see patterns. We'll see in West and Central Africa, most of the new pediatric infections are because pregnant women living with HIV aren't accessing HIV treatment during pregnancy or breastfeeding at all. Versus we'll look in Eastern and Southern Africa, and we'll see in countries where there have been really robust, very strong vertical transmission programs, the remaining new infections seem to be coming from women who are newly infected with HIV during pregnancy and breastfeeding. So prevention services in those settings are going to be needed. So I think having these tools at country level have really allowed many countries this year to tailor, for example, their Global Fund applications to address the specific gaps for their country at this time, not just a general program. And then I think finally, one of the most exciting work I think that we're doing currently around strategic information is supporting community-led monitoring. And this isn't new, but we're taking it to new levels. And we're really talking about monitoring by people affected, for people affected. It allows at community level, people to say, is what was promised being delivered? And is it the quality we need? It's critical for improving and sustaining high quality programs. And as this system, we require that there's a circle loop, feedback loop, both to the programs themselves, but also to national leadership so that findings can drive change. And it can be somewhat simple. For example, this year, our CLM project in South Africa, not ours, but South Africa's, found that in some communities, the average wait time at an HIV clinic was 4 to 5 hours. Now, it was no secret that there were long lines, but having the data concretely, having it consistent across a number of sites, having a forum where that information went back, not just to the clinic leads, but to the national leadership and funding partners, meant mitigation strategies that would improve the client experience and reduce loss to follow-up were funded and prioritized in that year's planning. So, we can really improve the situation of women, children, adolescents by ensuring those 3 components are now part of any monitoring framework. Because really when it comes down to it, data are not numbers, they represent people. Data don't speak for themselves. We have
data that then goes to the national, leadership and the funding partners and all that. But when we talk about data, then good data does not automatically cite political agendas or influence policymaking. I believe you know that. And I'll just circle this back to Dr. Saber and ask you, when we look at allocation of medical and health resources and our need to just help women, children, and adolescents recover, what do governments need from policymakers, from us, to make best use of the evidence, of the data that Dr. Hader is talking about? Is it the packaging, or what do governments need?
Well, first of all, it's my pleasure to be part of this panel, and I believe this is a very important question to talk about data and the importance of data, the evidence-based policies, and many other important topics. But I will talk about the importance of data, especially during COVID-19 and fragile settings like Afghanistan and other countries that are either in conflict or they are post-conflict. The availability of data is very important and critical for countries in conflict in order to develop policies and evidence-based documents in order to respond to the local needs, and then to focus on the marginalized groups of women, children, adolescents, and to come up with interventions to reach to those populations. And increased investments in generating reliable data is needed in order to enable us to respond to these needs for during COVID-19. Countries which are in conflict are challenged in collection of data because it's not easy to collect data. I will tell you a little bit briefly about the experience of Afghanistan. Although we have established this DHIS2 system for collection of COVID-19 data, but we have not captured the general picture of the country because there have been cases which were not reported. Either they were treated at home or there were cases which were treated in private health facilities. And at the beginning, we didn't have data from the private sector. The private sector was not involved. And there were many other challenges that made it difficult for Afghanistan. Based on the data that is available, it shows that in Afghanistan, we need to focus and to invest more into the community midwifery education and community health and nursing education programs, and also to make sure that we upgrade the current midwifery education and nursing education programs, which are currently 3 years programs, and they are not at a degree level, they are just diploma programs. We want to make them at least bachelor's, and in the next step, it will be master's programs as well. And we also want to improve the nursing and midwifery care at provincial and regional and national hospitals, and to enhance the role of nurses and midwives in the health sector. But there is also need to increase or to expand the primary health care, especially focus on the family health houses. These family health houses have been piloted in a number of provinces in Afghanistan, and we have seen great evidence that the family health houses have responded to the needs of women and children and in the areas that are hard to reach.
All right, great. Thank you very much. And I really appreciate that, Dr. Sabir, you brought out the issue of, how difficult it is for countries in conflict to, collect data and just ensure that you have everything when it comes to the numbers and evidences. And, we talk about data and evidence as what makes us, have a solid base, especially to achieve progress for women, children, and adolescents. But that is not all. Data and evidence have to be, accompanied by something else to make this a complete package. And here I'm talking about something like multi-stakeholder partnerships. And this is where I bring in Ms. Heda Verbag. And, when you talk of partnerships, for example, between every woman, every child, and the sun, COVID-19 is here. How necessary is it for such partnerships to be there and to flourish? And I want us to be very brief on this, especially when it comes to advancing, women, children, and adolescent health, not just during this pandemic, but even after. How do we capitalize on multi-stakeholder partnerships?
Thank you very much. I first would like to echo what Shannon Hader has said. Big hand to every woman, every child. You have done great things, but you have an even bigger task ahead. Because what is COVID-19 learning us? That it's not the focus on one thing and coming forward with global solutions that are dropped on countries that will do the trick. What COVID is learning us is that there are system failures in which diverse departments, health, family affairs, women, social protection, education, food production, economic development, they are all failing because they're all playing their own game, and they want to get the flowers for being effective. Now, that's not only happening in developing countries, it is in every country. So what needs to be done is to develop a responsibility and an accountability system in which there is recognition of collaboration and there is recognition of each player, each actor into bringing solutions that are owned by people. I appreciate what Shannon said about this. Community action, community ownership, community monitoring. This is what we need, not only for multi-sectoral collaboration, but also for multi-stakeholder collaboration. because listening to also Dr. Osmani, it is crucial to agree in a developing country, and that's our own experience, upon one way of data collection. And right now we see different players having their own data, confusing each other, or when it comes to formats, to change things. Organizations want to encourage a country to use their format. Let us stop doing this. Let global leaders, and that is a behavior change, a leadership change, be ready to focus on the situation at country level. Make sure that the government is responsible, that policy change takes place at country level, but that action and implementation and measurement and change is owned by people themselves. And that is the systems change we need to see. And I would like to invite every woman, every child to develop an accountability system with indicators on two issues: on how a country is making progress, and secondly, on how the different partners in the partnership are contributing to this in order to develop a system of naming and faming, sharing the flowers and the honor, and if need be, of naming and shaming. Because those global initiatives that come with a big bunch of money and that like to impose their solution on a country, they should also be held to account, but then encouraged to improve behavior.
Wow, that's a very good challenge to every woman, every child. And you know, when you talk about change being owned by the people themselves, we cannot have people in the grassroots, people in different countries owning this change if they have not been included in their decision-making table, if they have not been included in the processes that are generating this change, right? So, Dr. Smita, I will come to you with this question because you know, you have been working with women and adolescents directly to understand and address the unique pressures they are facing in Rajasthan during this time. And I just want you to let us know how COVID has exacerbated their circumstances. And in essence, what must we do differently to address the social fractures and inequities both during this time of the crisis and well into the future?
Hello?
Yes, Dr. Smita, I can hear you.
Namaste, how are you?
Namaste, thank you very much.
It is a pleasure to be with such great speakers on this very important topic. And thank you, White Ribbon Alliance and PMNCH for providing this opportunity. Today, we are all aware that the world is making efforts to address the challenges of COVID-19. And all the governments, civil society organizations, development agencies are making a lot of efforts to address the same. And today I will be sharing some of the insights into what women have said when we went to them. Just going into a brief history, back in 2016, White Ribbon Alliance India started a campaign called Hamara Swasth Hamari Awaaz, in which we asked almost 3,500,000 women on what is their one ask for quality maternal health services. And these asks were shared with the government, the highest level of decision making of India. And in continuation with that, in June 2020, it was just the beginning of the unlocking phase in India. We talked to more than 12,000 women, young women, from 5 states of India. Perhaps what women have said may have changed because after the unlocking phase, the government of India has made substantial efforts to address issues due to COVID challenges. But I would really like to share what women have said and some glimpses into what came out when we discussed with women. Overall, it appears that COVID-19 has meant more drudgery, stress, and deepening of gender divide. It is an overall impression that women gave with us. For example, when we talk to women, they said that when families came back, there were more family members in small houses. And given the social structure, women had to live in very compressed situation. When families came back, for 70% of women, loss of livelihood was a major jolt. For them, loss of livelihood meant no money, and no money meant no money to buy food and other supplies for the family. And automatically, when there is not enough in the family, women bear the brunt. So almost half of them said that there was not enough food for the family, and obviously, women went hungry. Similarly, more hygiene, more sanitation meant more water in houses. And automatically, the responsibility of fetching water from a distant source fell on women. So their drudgery increased. A lot of women shared that they had to go out to buy vegetables, to buy grains for their daily needs, despite the fear and risk of going out. More than half of women said that the incidents of violence on women were more than usual. We did not go into defining and deeper into the issue of violence because it was a very sensitive issue, but women did share this. When it comes to accessing health services, women shared, almost half of women shared that we were scared. We were scared that this facility may be closed. We were scared that we might get the infection in the facility. For some, there was no transport available. There are also some good things, and I must acknowledge that during this period, the government of India made substantial efforts to inform people. And when we talked to women, and it was a surprise for us because rural women said that 70% of women said that their main source of COVID-19 information was TV. And government of India had really made substantial efforts to inform through public medias, TV, and all channels. So it was a very good initiative, and I think this should be promoted. Frontline workers also went to homes and informed women, and they appreciate that because not all women had access to TV all the time. So this was a very good initiative. Women also said, almost 50% of women said that they received government support during this critical period. And that support was in terms of food grains and in terms of money. And they really appreciated that effort. 1 in every 5 women said that they also received support from civil society organizations. So overall, it appears that given the social structure, women have to bear the brunt of anything that happens in this world. And what White Ribbon Alliance is making effort is listening to what women are saying and informing the world that these are what women are saying, these are what women want, and there is a need to change systems. There is a need to substantially change systems. And when today we are talking about data and evidence and community monitoring, I think the first change we need to make is listen to women. And look at when we are designing policies, programs, and actions. Look at these actions from women's lens and include women's voices in the evidence-based decision-making. Usually, we tend to listen to more scientific, rigorous evidence, which is good. But then women have their own way and their own need. So I think that needs to change, and women's voices must form the evidence-based decision-making. The second and most important change that we need to make is challenge and change gender stereotypes. In all our communication, in all our action, I think gender stereotypes must not be repeated or perpetuated. And today, the most important need is inclusiveness and male responsibility to become partners in this whole challenge. The third and most important change we need to make is no tolerance. No tolerance for violence against women, for disrespect, for discrimination, for denial to all women, all the time, and at all places. I think this is very critical and we need to change this. The fourth most important change is the need for a multi-pronged strategy. The government of India has really made efforts to use all strategies to reach out to people. And given the social structure, women are usually left behind. So to include them in this package, there is a need for a multi-pronged strategy which uses all sorts of platforms, even one-to-one messaging by frontline workers in local languages, and information which is gender sensitive is also required. Women also said that they want information, complete information about their entitlements so that they can avail them. So there is a major need to look at the communication strategies that we have and really look at who needs the most. The next important thing is role of civil society organizations. The civil society organizations are there to support the government. Governments cannot be replaced and civil society organizations cannot reach the vast area that government can reach. But they need to be supported, included, so that they can support the government to address what women want. Last but not least, access to health and nutrition services with dignity is very important. Services are essential, and from what women have said, they need services, the complete package of services, which are affordable, which are accountable to women, and which are nearer to their homes. And COVID-19 has taught us that there is a need to strengthen public health systems. We need to focus and strengthen these systems, and primary health care is the basis.
Wow, thank you very much, Dr. Spina. And I think I'll just have to cut you short a bit there because you've said some really, really interesting and powerful points that I can't just let go. And for me, the most important, or what I've really gotten out from what you say, is, listening to what women want and making the change in accordance to what their needs are. And I know we can talk about women and what they want and their needs and all that all day long, because when we start talking about no tolerance to violence and discrimination and all that, then these are conversations that can just go and on and on. But we do not have the time, and I will just ask every one of us to continue these conversations on chat and also on social media. And people are talking about so many things, like there's people want issues around domestic violence and discrimination addressed. And I just encourage you to keep the chats happening, and
Mercy, can I jump in here 1 second? Because I really love all the solutions that Dr. Smita has put at the table. They're all very true. But let me share one more thing.
Go ahead.
Female champions who are encouraging girls and boys to respect each other as equals, so that they are able to encourage and raise a generation of girls, adolescents, and women who do not shy away once the men walk in, who are not modest, but who are acting with self-esteem and self-confidence and are respected for this. Without this addition, I'm afraid we can continue to make this advocacy forever, but this should also be brought to the table.
Thank you very much. And basically, those are the things we are talking about today. And thank you very much for raising that point. And on that note, allow me to end this panel here, because like you see, guys, there's so many things to talk about. So thank you very much, ladies and gentlemen. That marks the end of our first session for this discussion. So Dr. Saber, Shannon, Ms. Geda, and
Namaste.
Thank you very much for your time and absolutely valuable lessons on data that you have given us, in the progress for women's, children, and adolescent health. And we will go straight into the second half of this discussion because we need to look at, we've looked at the 10 years that have passed. Now we need to look at the decade of action, and that's the decade ahead. We need to look at solutions, investments, and accountability that we need to get us back on track to achieving the Sustainable Development Goals. And now allow me to welcome on the virtual stage our esteemed panelists for the second part of the discussion, Ms. Ana Claudia Carleto, Secretary for Human Rights and Citizenship of the Municipality of Sao Paulo, Brazil. Thank you so much for joining us. And then we have Ms. Beth Schlachter, Executive Director of Family Planning 2020. Thank you so much. Dr. Monique Leda, Head of Secretariat and Practice Manager, Global Financing Facility. You are very welcome. Ms. Toyin Chukwumozie, Education as a Vaccine and member of the PMNCH Adolescents and Youth Constituency. And lastly, Ms. Joy Fumafe, co-chair of the Independent Accountability Panel for EWEC. Thank you so much, ladies, for creating time to be with us today. And we are going to look at the decade ahead and, the solutions that we need, the investments we need to make. And keyword, accountability. So without wasting any minute, and as always, please, our audiences, keep your comments, your experiences coming in. And I will go straight to Ms. Ana Claudia. Our resources are finite, the science is definitely in properly managing and balancing them. Yes, we are in a pandemic that requires lots of resources to manage. But how do we ensure that there is proper balancing of resources and priorities so that not all human and capital resources are geared towards COVID-19 efforts at the expense of other essential services and especially provisions for women and children? And you can give us, your experience from the municipality of Sao Paulo. How are you doing it? How are you, managing those resources to ensure there's that balance? Sorry, we cannot hear you, Ms. Ana Claudia. So I think you are on mute. No, I think you are still on mute. As you sort that out, maybe we can move to Beth. Beth, are you ready?
I'm ready, thank you.
Oh, great. So, Ana Claudia, I'll come back to you in a minute. Maybe we can just sort out your audio. And, Beth, I asked Ana Claudia, the issue of managing resources, and I'm coming to you because, Every Woman, Every Child report shows that, there are billions of resources in US dollars that have been mobilized in financial commitments. We're talking about about 44 billion USDs, in terms of financial commitment. And they were talking about an addition of about 97 billion USD pledged by India. And this is just essentially to advance the health and well-being of women, children, and adolescents. What has the impact of these investments been on the health and well-being of this group over the past decade? And how do we ensure that we protect, the investments that have been made, especially during this COVID-19 period, seeing just how disruptive it is on the progress that we are making?
Thank you so much for that question. And it's an honor to be a part of this panel where I know everybody here will have really important perspectives on these issues with regard to financing and accountability. I really want to thank, as well as the previous panel did, Every Woman, Every Child, the Secretariat, PMNCH, and White Ribbon Alliance. It's a great session here to be a part of, and really critical issues that we have before us. And as you mentioned, the $44 billion that have been mobilized represent the cumulative effort of almost 350 commitment makers spanning across sectors and issue areas. At FP 2020, we've been specifically focused on mobilizing support and commitments to advancing family planning, which we know is foundational for enabling women and girls to live fuller and healthier lives and conferring them those benefits not only on their children and their families, but for entire communities. As of last year at this time, there were 314 million women and girls using modern contraception across the 69 lowest income countries alone. Our partnership has enabled an additional 53 million women and girls to use contraception since 2012. And so the impact of this contraceptive use is real and profound. In the last year alone, it's meant 119 million unintended pregnancies were prevented. 21 million unsafe abortions were averted, and 134,000 maternal deaths. 134,000 women and girls lived through childbirth because of contraceptive use. That's the power of working together and why we need to continue to stand strong and stand together as COVID-19 threatens to reverse this progress. Because we know that the pandemic has intensified pre-existing challenges and created new ones with long-lasting detrimental consequences, especially for women and girls. We know from WHO Pulse surveys that of all health services, family planning has experienced one of the most profound and severe disruptions, with nearly 70% of countries reporting some disruption and almost 10% reporting severe or total disruption. These are essential, life-saving services that are not being provided, and we must address this now or risk losing all of the progress the global community has worked so hard to achieve. However, even before COVID-19, as you mentioned, investments in health, the services and systems were under-resourced for everybody by almost $200 billion. And of course, it's precisely the populations we're here to talk about today, women, girls, and children, that all bear the ultimate cost of the lack of resources. For family planning specifically, meeting all needs for contraceptive care in low and middle income countries would cost $12.6 million annually. That's $5.5 billion more than is currently being spent or was spent before COVID. So if we're to refocus, if we're to recover, as this report says, we must reinvest as well in our health systems, in our accountability to each other, and in our partnership. FP 2020 is turning to that now, and I know that Every Woman, Every Child and PMNCH are as well, as we reimagine and recommit our own partnerships. And we all believe that women and girls deserve nothing less. So thank you.
Wow, thank you very much. And, on that note, let me just come to Joy. Dr. Heather talks about, these millions of dollars that, have been input into women, children, and adolescent health. And, even when you talk about COVID-19 and managing, how we are responding to the needs of this group, we are still seeing reports of embezzlement of funds and, sorry to say, people in government just going haywire with money that is supposed to be channeled towards COVID-19 and women, children, and adolescents. The 2020 report of the Independent Accountability Panel raised an alarm on these and warned that an estimated 20 to 40% of health expenditure is wasted globally due to inefficiencies and corruption. How does this affect our fight for proper health and well-being of women, children, and adolescents? And as countries or organizations, we need to ensure full accountability, which connects commitment to progress, right? How do we do this with all that's happening?
Thank you so much. And I would like to thank PMNCH. I would like to thank Every Woman, Every Child, Right to Born Alliance, and members of the panel. Indeed, corruption is taken root in the health sector globally, whether it be in domestic public sectors through local official bribery, embezzlement, whether it is the private sector with their business, with investment as the benefit is given by the type of corruption that is perpetrated by this led to politically motivated investments. Strongly advocating for is the urgent institutionalization of accountability. How do you, accountability is a must-have for good governance. It is not a nice to have. It must be permanently embedded so that leaders, managers, implementers, partners, and all stakeholders are committed to the people they serve and seek to support through an open, transparent, timely, and regular sharing of information on their roles. People must know, what is the role of my politician? What is the role of my district health manager? What is the role of my nurse? And what resources do they have to give me the services that they're supposed to give me? And what are these services that they must give me? And they must justify, that is, these leaders, these managed actions, openly and transparently. Explain them. They must be based on evidence. I think COVID-19 is teaching us that very, very effectively. They must be based on the rights of communities, of women, children, and adolescents, and the rule of law. And it is for this reason that we are saying civil registration of all deaths is critical. Unregistered people are invisible. They will not be planned for and they will not be covered. Causes of mortality that are not recorded will also be unplanned and they will not be addressed. And what we are saying is that they must implement institutional, open, transparent core accountability functions, monitor, review, remedy, action with the participation of communities. Open monitoring, open results and impact so that people knows what is progress towards the goals and targets. What we are saying, accountability must be democratized. So the content and the quality expectations are taken into account. Countries like Ghana, countries like Ethiopia. And what we are saying is that let us take lessons from these best practices.
Sorry, allow me to interrupt you, Joy, because we're getting a lot of disruptions from your end. I think your internet is not stable and it's become pretty difficult to get what you are saying comprehensively. So please allow me to interrupt you a bit as you try to maybe sort that out and move back to Ms. Ana Claudia Caleto. Are you back on? Say something. Hi.
Hi.
Great.
Can you hear me?
Yes, I can hear you now. Sorry about those audio issues. And yeah, we can now hear you clearly all the way from Nairobi. And I bet everybody from the 109 countries are hearing you nicely now. And I just posed to you a question about, our resources and they being infinite and, just how to manage and balance these resources to ensure that we do not, cut what should be directed towards, responses on women, children, and adolescent issues and their health and well-being in favor of, working on other issues relating to COVID-19. As much as we appreciate this is a global pandemic, there must be a lot of resources that must be channeled towards that. But how do we get that balance to ensure that we do not do this at the expense of women, children, and adolescents?
First of all, good morning at all. I'm glad to be here. And on behalf of Mayor Bruno Covas, I would like to salute all the organizers of this panel. So Mayor Bruno Covas has been publicly advocating for the rights of vulnerable people, especially during this pandemic, take care of them and listening to their demands as a center of goals of his mandate. In terms of essential health, São Paulo built 3 field hospitals in order to guarantee that everyone will have access to public health, relieving the public hospital network. Thanks for this decision, the city never had to decide who would live and who would die. During the COVID-19 pandemic, the mayor also created a program called Solidarity City. Since May, we have bought more than 1.5 million food and sanitary kits to vulnerable people in São Paulo, distributing these items in partnership with the Red Cross and NGOs working directly with women, indigenous people, migrants, the elderly, etc. Of course, there are specific actions taken by each office during the COVID-19. In the case of the Secretariat of Human Rights and Citizenship, for instance, we have already distributed over 1.1 million packed lunches to homeless people in the city, including for almost 4,000 homeless women and children in São Paulo. When we work in front line, we need fast response for humanitarian needs. We must rethink and rebalance all our resources and priorities. That is inevitable. People in the city need short-term assistance in moments of crisis like this. However, we also need to balance this reality coupling with long-term measures to foster the autonomy of vulnerable people and social minorities. In this regard, the Secretariat of Human Rights and Citizenship kept open all its equipment and service during the pandemic, with special attention to families with vulnerable children and women. As I said before, specific actions are taken by each office during the pandemic, especially to avoid overlapping public expenses in time like this, where we need to spend wisely and plan ahead of the time. Innovation and creativity in this sense are special features of our municipality to ensure healthy lives and promote well-being for all and at all ages, and also to ensure inclusive and quality education to promote lifelong learning opportunities for all, making cities inclusive, safe, resilient, and sustainable for all the next generations.
Wow, thank you so much, Ana Claudia, for those comments. And, you are talking from, your experiences and what is happening in Sao Paulo municipality. And, we have somebody from the Global Financing Facility here, Dr. Monique Leder. And even as we reflect on what Ana Claudia had said, let me just ask you, she's talking about, what they have prioritized as a municipality in the country. And I think of your role at GFF as you know, an entity that is supposed to help governments to, transform how they prioritize and finance the health and nutrition of the people. And I think that role is really key, especially now. And when we think of focusing on care during pregnancy, birth, and, early years, adolescence, and primarily just general care for women. So could you just explain how GFF is supporting countries right now in their own response to decisively save lives and protect the delivery of essential services as part of trying to navigate this pandemic, get out of this pandemic and even thrive after the pandemic is done?
Great. Thank you so much, Mercy. It's really an honor to be here this morning. I'd like to also thank the organizers, and it's so wonderful to see so many colleagues and old friends. It's a shame we can't meet in person, but it's really great we can have this conversation. And so for the Global Financing Facility, we have since COVID started, worked with the 36 countries that are currently part of the GFF program to look at, with the Ministries of Health, to look at the essential services and are the services reaching women and children. And last week we released a press release with the analysis of the first 10 countries, 63,000 health facilities,
really showing, even though there's quite a variation between the different services and between countries, we're showing quite a severe impact on the disruption of essential services for women and children. And just to give you an idea, for example, in Nigeria, we saw a 16% decline in antenatal care. We see across the board a significant decline, sometimes up to 30% of outpatient visits, as well as child vaccinations. And so, taking that into account, when we started seeing that in February and March, we immediately set up a virtual programmatic policy platform for all of our countries to participate, look at this data, and based on their local context and country needs, to design and finance programs that can address these challenges, to really ensure that we can continue those essential services on country level. And it's really great to see how around the GFF the partnership comes together. And we saw a tremendous engagement of civil society from very early on in the COVID response, to really ensure that there was sufficient advocacy around the issues for women and children. We're also looking at the issue of supply chain. And so there's been quite a lot of disruptions in availability of important commodities that will allow quality of care for women and children. And so we're looking into the local production of protective clothing for health workers, so that they can continue staying on the job, as well as for certain commodities, particularly for Africa, so that they become less dependent on global supply chains for those important commodities. And maybe just to close off, because I know you want to keep time for discussion, which is always the best part. We are launching the new strategy. We're at 5 years of implementation, and the doubling down, the COVID crisis has more than ever shown the importance of a functioning health system. And so we're doubling down on the essential services and the system strengthening agenda in collaboration with partners. But I also just want to build on what Joy was saying around the accountability, the importance of the voice of women in shaping health services. And that also includes a really big emphasis we want to put on female leadership. When women are in decision-making positions, it's very well documented that they make decisions that really take into account the needs of women and children. And we want to further strengthen that and ensure that we have not only as health workers, nurses, women contributing to healthcare, but that also in the decision-making, including on financing, women can take the lead on ensuring that we have a better future for all women and children and adolescents. Thank you.
Thank you very much, Dr. Monique. Now, and I'll come now to you, Toyin. All the speakers that have spoken before you are talking about financing, are talking about resources and good technology. And, with all these then comes so many innovative solutions to, addressing gaps of women, children, and adolescents. But, when we talk about technology and innovative solutions, we also have to talk about broadband and social media, and how to use this from service delivery to self-care and information sharing. But this is not really the reality for many people who are maybe, living in places where there's no internet and all that, and there's this digital divide. How do we ensure that no one is left behind, even as we focus on financing and technology and building resources, and as a way of rebuilding our system after COVID-19 and in preparation for future pandemics? How do we ensure that no one is left behind and that digital divide or that digital gap is really minimized, if not eliminated?
Okay, thank you so much, Mercy, for your question, and thank you very much to PMNCH for the opportunity to be a part of this conversation. I'll start by saying that the solutions that we have to provide, they have to be multi-component solutions, and they have to fit our context. These solutions have to take into consideration the fact that adolescents and young people are not a homogeneous group. And so they have to be tailored to their needs. And of course, we have to work in partnership with adolescents and young people to tailor the solutions and ensure that it suits their needs. Having said that, digital solutions, yes, they do have a great potential to reach adolescents at scale, wherever they are. And I'll share our experience at Education as a Vaccine, a youth-focused organization in Nigeria. We've been using digital platforms to provide sexual and reproductive health information to adolescents and young people since 2005. We started with learning about living. This was an electronic curriculum that provided life skill information, sexual and reproductive health information, and it was web-based. And so young people would have to go to cyber cafes. At the time, this was the easiest way to get access to the internet as a random person. Of course, this has its own challenges. And so with feedback from young people showing these challenges and stating these challenges, we then evolved to providing hotlines services, and then also expanded to a service we call the My Question and Answer service. So this is like an SMS-based service, so a short message service, just sending text messages to a short code. And the platform was created for young people to ask questions and get accurate answers from a trained counselor on the sexual and reproductive health, even their relationship concerns, and it was for free. So from any mobile phone, they can send a text message to that short code, and the service is anonymous, it's confidential, and it's a non-judgmental service. We've reached over 1 million young people in Nigeria since inception. And we've worked with young people over time who themselves are telling us what works for them. And so in this way, we sort of are creating like an ecosystem of solutions that can be integrated into any program or any intervention to meet the needs of young people. We've reached a diverse group of adolescents and young people, including young people living with disabilities, young people living with HIV, in school and out of school young people from diverse sexual orientations, young people who are in internally displaced camps. I want to emphasize that these services have to be toll-free, as this is key to increasing access and improving access. There's also a need to continuously assess and update digital solutions to ensure that we are reaching the most vulnerable and the hard-to-reach adolescents. With all the disruptions that COVID-19 has brought to health and to education for adolescents and young people, it is clear to us that there needs to be a move beyond face-to-face interactions in providing the support that young people need to improve their well-being. So we really need to explore and take advantage of the possibilities that digital solutions can offer in providing life-saving information, including comprehensive sexuality education for adolescents and young people. And there are many ways that we can do this. We can provide toll-free hotlines. We can provide free text messaging services. WhatsApp can be a platform to be leveraged. We can provide animated videos that have the content that we want to pass across in the local languages. We can also, of course, leverage social media. And of course, for young people who are in urban and settings, mobile apps as well can work. But traditional media, such as radio, is still very valuable for adolescents who are in hard-to-reach areas. In a country like Nigeria that is really vast, there are adolescents in areas that are geographically almost inaccessible. And you see that radio is still one way to reach them with information. But it is important for me to also mention that young people would access services in an environment or through a medium that they can trust. And so it's important to protect their privacy. It's important to maintain confidentiality to enable them to engage effectively. Lastly, I would add that it's also very important to strengthen advocacy around delivering different solutions, including digital solutions for adolescents and young people, because these solutions can only work when we are contributing to an environment where the laws and policies make it possible for the solutions to reach those who need them. Thank you.
Thank you very much, Korean. We could go on and on about the decade ahead, and because there's so much to discuss. And I know we were looking forward to a little bit of a chit-chat back and forth between us. But because of time, unfortunately, I have to end it here. So thank you very much, Anna Claudia, Babe, Dr. Blada, Toyin, and Joy for the wonderful insights on how to ace the next decade. And my key takeaway from these deliberations are that even as we celebrate progress globally, we should be careful to note that the progress is not equal, and still there are many other regions where women, children, and adolescent health and well-being are doing so badly. And we have learned of the need to address the gaps and challenges that the global community must urgently act on to ensure that we just have more investments in sexual, reproductive, maternal, newborn, and child health. And even as we seek more investment, especially on the financial front, then the big question will be, how are we utilizing this money? Is it going to the intended recipients? Is it going to the most vulnerable? And we should not forget that data and evidence are powerful tools in advocacy and decision-making. So thank you very much, our esteemed panelists, for your time and your really, really valuable information. We really appreciate. And on that note, I will transition to the next session. And we are calling this Brave Voices, Bold Actions, delivering on what women, adolescents, and children want during COVID-19 and beyond. Now, from Uganda to Mexico, Nigeria to Brazil, the US, and DRC, all over the world, there is one deep desire, genuine desire from women, and that is to be heard. The What Women Want campaign has been described as the largest ever open-ended survey into women's opinion on their own needs for quality and reproductive and maternal health care. It is the authentic, brave voices of 1.2 million women of all ages from all walks of life, from more than 100 countries. Now, these women were asked about their top priority for quality maternal and reproductive health care services, and they gave a list of demands. And these are demands that they want political commitment, investment, and accountability on. This next session is what I think of as citizens' parliament. Basically, we are giving the voice to the people, but not only the people. This is also a moment of discussion on both leadership and citizenship. And we are seeing these people come together and just reflect on all these words. And speaking of citizens' voice, let's first begin by hearing from women and young people themselves in this video from What Women Want campaign, convened by White Ribbon Alliance.
I have a right to quality services.
اوس زه دا غواړم چې زما د خپل علاقې خپلې زنانه د خپلو ماشومانو او د خپل ځان د صحت خیال وساتي او د خپلو ماشومانو د خپلو حقوقو نه خبر وي.
kazarira aha omu kibira omu mwirima ubwo omushaija wanje yabira nyine ntuza omu igwariro eryabire risaate kilomitazi kuruga omuka.
zovuta zimena kumana zikuminiko timabedi amene ali uchepa pamalopo oti mukazaza anthu amatha kumala kidomina zimatisi pasi mmangugo.
Obwe ndikuteekateeka ngu ekyanyima nikiija kwija kugumamu kindetera okujwa mpika kufa konka omwana wanje akaba ahuriire.
زموږ دا حق دی چې موږ ته د دلته هسپتال کې بهتر سهولیات موجود وي، د هسپتال انتظام دی صحیح وي او د هسپتال کې د صفایي خیال ضروری دی.
kuno kuli mavuro raona nirele kwabonda nyasizo kazoka vimadzivo kavoka tala rufuna kuri munkuno akukusinthe
ezimene liona kuno kubodza nzovura zedi kulira vile kuchimbudzi kuzimbudzi vose vidadzala kumasikira sosiko zosho
ndasikuno kuna chiremba ndinazoti ndikasvika wepo kwanu kubato zvakanaka taura nemune zvakanaka tichitaura tichinzwisisana kana kanganisa achindiratidzawo mune zvakanaka.
Ladies and gentlemen, now more than ever, it is time to listen and act on these demands. Already, this pandemic is disrupting so much, the provision of life-saving maternal services and adolescent health services. It is eroding sexual and reproductive health and rights of women and adolescents. And we're just seeing an exacerbation of systematic and structural racial, ethnic, and gender inequities everywhere. In July, we had the Lives and the Balance virtual summit on COVID-19 and women, children, and adolescent health. And there we launched the PMNCH call to action on COVID-19. And there were 7 asks to governments for greater action on, and, asking for investment, policy, and service delivery. And you can see these asks in depth on the PMNCH website. So in this next forum, we bring forth dialogues between women and decision makers based on 4 main asks. We are going to look at respectful and dignified care, clean health facilities, toilets and water, what we, refer to as WASH. And then you're going to look at essential sexual and reproductive health, medicines and supplies, and finally, at more and better trained nurses and midwives, because essentially that is very important, especially during this time. And before we get into that conversation, again, I just want to ask our audiences, please do keep the conversations going on chat. And this time, I want you to let me know your name, your country, and tell us that one demand or issue for more action on COVID-19, and what you're just asking the various decision makers, whether they are on the panel or those who are watching this or those who will watch this, because this will be online for quite a long time, what you want more action on COVID-19. So put that demand or that issue you want to address, you want more action on the chat box. And my colleague Jane is keeping an eye on your responses. And maybe we can look at some of those responses after the first panel and at the end of the session, Jane. So for now, let's get the conversations going on our virtual stage. In our first panel, we'll be discussing issues around respectful and dignified care and water sanitation and hygiene, like I mentioned. So joining me on screen is Honorable Dr. Harsh Vardhan, Union Minister for Health and Family Welfare, India. Thank you so much. Really good to see you with your mask on. And then we have Ms. Paulina Nyona from the Organization of African Youth Kenya and PMNCHA NYC member. And lastly, we have Honorable Professor Margaret Kobia, Cabinet Secretary, Ministry of Public Services and Gender in Kenya. Welcome. In Swahili, we say Karibu Sana, Dr. Harsh Vardhan. It's really, really good to see you. But as you just get comfortable in all this, first, let us watch this video testimonial done by Reena Yadav, member of Legislative Council, Bihar in India.
नमस्कार, मैं रीना देवी उर्फ रीना यादव नालंदा से बिहार विधान परिषद की सदस्य के रूप में आपके सामने उपस्थित हूँ। साथ ही साथ सत्तारूढ़ दल में सचेतक की भूमिका का भी निर्वहन कर रही हैं। मेरा मानना भी है और मैं ये समझती भी हूँ और पूरी तरह से इसको मैं मजबूती के साथ सदन में भी रखने का काम करती हूँ कि हमारे स्वास्थ्य सेवा को गरिमापूर्ण और गुणवत्तापूर्ण और बिना भेदभाव के स्वास्थ्य सेवाएं समुदाय के हर व्यक्ति को मिलनी चाहिए और खास करके जो हमारी महिलाएं हैं उन तक ये विशेष करके ये स्वास्थ्य सेवा का लाभ उन तक पहुंचना चाहिए। 14 दिन का जो क्वारंटाइन करने का जो पीरियड था उसमें जो हमारे जनप्रतिनिधि थे, चाहे वो मुखिया के रूप में महिला जनप्रतिनिधि थे या वार्ड सदस्य के रूप में थे, उन्होंने बहुत ही महत्वपूर्ण भूमिका निभाई। इसके साथ ही साथ मैं आपको बताना चाहती हूँ कि हमारी आंगनबाड़ी की जो सेविका थी उन्होंने भी अपनी जिंदगी की परवाह न करते हुए, अपने परिवार की जिंदगी की परवाह न करते हुए फिर भी वो घर घर जाकर के उन सूचनाओं को प्राप्त करने में सक्षम रही। जनता के सामने अगर कोई समस्या आ जाए, किसी तरह से खून की कमी की परेशानी या डॉक्टर का ऑपरेशन करने से इनकार कर देना या फिर महिलाओं को धिक्कार देना या गरीब है तो उसको किसी और जगह भेजने का प्रयास करना, तो ये छोटी मोटी जो जटिलताएं या जो समस्याएं हैं वो हमेशा यादा करना हमारे सामने भी आती रहती हैं। तो इसके लिए हमने अपने जनप्रतिनिधि को वहाँ पे रखा है हमारे सदर अस्पताल में, जहाँ पे वो हमेशा रहते हैं और एक फ़ोन कॉल के जरिए हम लोग उनसे बात करके उनके साथ उनको भेजने का काम करते हैं। और अगर आवश्यकता होती है तो हम लोग डॉक्टर से भी बात करते हैं। अगर आवश्यकता होती है तो इस तरह के समस्याओं से जूझने में जब ज़रूरत पड़ती है तो हम लोग विधान परिषद में उन समस्याओं को भी रखने का काम करते हैं। जैसे कन्या उत्थान योजना, जिसमें किस तरह से भ्रूण हत्या को रोका जाए। हमारे यहाँ जो छात्रवृत्ति के रूप में, पोशाक राशि के रूप में, साइकिल योजना के रूप में और नैपकिन योजना के रूप में बहुत सारी योजनाएं हमारे स्कूल में, हमारे सरकारी स्कूल में लड़कियों के लिए दिए जा रहे हैं। तो मैं समझती हूँ कि जब शिक्षित महिला, कोई भी शिक्षित महिला जब अपने अधिकारों के लिए जब बाहर जाती है तो उसे कोई भी व्यक्ति जो है धिक्कार नहीं सकता है और उनकी समस्याओं को नहीं सुनने का कार्यक्रम नहीं कर सकता है। आप सभी को हृदय से आभार प्रकट करना चाहती हूँ कि आपने एक विशेष मुद्दे को लेकर के मुझे इस कार्यक्रम में बुलाने का कार्य किया और मुझे एक मौका दिया कि मैं अपनी बातों को रख सकूं।
Dr. Harsh, I will come straight to you. You have seen Rena's video and she raises some points on quality, respectful and dignified care. Now, India remains one of the most high-risk places in the world to give birth. And, you know, almost all the deaths that occur are preventable. But even as we know that fact, we know that, you know, there have been, processes and all these measures put in place to try and continue decreasing India's maternal mortality rate. What are you doing to make this a realization? What are you continuing to do to ensure that this fact is eliminated and basically we see a continual decrease in maternal mortality rate in India, especially when it comes to that aspect of realizing women's right for quality and respectful healthcare?
Thank you, Mercy, for that vitally important question. And I must admit that I and my government have been trying to address this issue on priority. This sentiment was echoed by Ms. Reena Yadav, whom you all heard, and it is so very heartening to see that local leaders and their voices are getting global platforms and recognition to showcase the tremendous lift that local administrations have made in the past few months, despite the pandemic. Regards to your question, we reckon that maternal and maternity care goes much beyond only healthcare services for the mothers, but sets into motion an experience for lifetime. It's the lived reality of a woman who depends on a responsive system to cater to her needs of not only services, but also dignity, privacy, confidentiality, choice, and respect for her as well as her baby. It is not just about a provider or a client. It's about human dignity. That was the reason that our government has been working in an incremental manner to provide respectful maternity care. From instilling a behavior change to help more women deliver in hospitals, to entitlements for absolutely free services, we have come a long way now in providing quality care throughout the pregnancy and childbirth with interventions like Lakshya and midwifery care. Last year, I started a Safe Motherhood Assurance Suman initiative that brings all these services under one umbrella. We are now following a zero tolerance approach for service denial to pregnant women and their newborn babies, and have also strengthened our system for client feedback, grievance redressal, and greater accountability and transparency. The idea is to have a fully responsive and accountable health system that will not only result in a positive birthing experience, but also help end preventable maternal and newborn deaths.
Well, thank you, Dr. Vardhan. And you talk about human dignity and having a responsive health system to take care of maternal health and to end the preventable deaths that we are witnessing. Now, I will come back to you shortly, but before then, let me tell you, ladies and gentlemen, a little story that really saddens my heart. 2 weeks ago, there's a video clip that went viral on social media in Kenya. And this video was played on news, in major television stations. It shows a man emerging from a car at the gates of Kenya's largest maternity hospital, and this is Pumwani Hospital. This man was carrying his pregnant wife who was in labor. She was crying and in need of immediate attention. But they were denied entry into the hospital and told that the medical workers were on strike. The woman was overwhelmed with labor pains. She could not make it to another public hospital, and she could not afford to go to a private facility. Now, ladies and gentlemen, right outside the hospital, which sits in front of a really busy highway with hundreds of cars and people passing by, this woman lay down, wailing, desperately calling for help, and a few minutes later, she gave birth on the tarmac road, right outside the hospital gate. Zero privacy, tens of onlookers, some filming her ordeal on video. That video is still trending, and the internet never forgets. The video will still be up for years and decades. Just picture the disrespect and the indignity. Professor Margaret Kobia, this happened in your country, my country, Kenya. Is there anything that justifies a mother delivering on tarmac at the gate of a facility that should be taking care of her?
Thank you. Thank you very much, Imase. My name is Margaret Kobi. I come from Kenya, Nairobi. And I just want to respond to that unfortunate incident where a mother actually delivered around the gate. That is an example of what should it happen if all the systems were working well, but the incident happens, and I think we should take it as a lesson that that's not what we want to see happening to the women anywhere in this country. Therefore, I would say in my case, one of the demand that is facing our country and from where I sit is the demand for inclusion so that women have an opportunity to participate in decision-making on matters that concern their own lives. Therefore, that was quite unfortunate, and what that teaches us, Mercy, is that you can have very wonderful policies, strategies, which is saying what should happen. In Kenya, we have universal health coverage, and we have the Linda Mama program, which have worked very well. But one incident like this, which happened when the Pumwani Hospital was on strike, cannot be excused. But that tells you just having policies and systems and the strategies in place, you need more than that to ensure that the systems actually work and serve the women and the children according to their needs.
Well, thank you for your response, Dr. Kobi. Now I'll go back to Dr. Vardhan, and maybe all of you can just, keep reflecting what I've said in mind, and that should form the basis of, the discussions we're having today. And when we talk about respect and dignified care, those are some of the things we just don't want to hear of or see. And Professor Kobia talks about responsive policies and ensuring women sit in decision-making tables and all that. Dr. Harsh, how can governments ensure that, the notion of safe motherhood is expanded beyond the prevention of morbidity or mortality to look at the respect for women's basic human rights and, preferences during maternity care, especially during this period? And, when you talk about preferences, we're talking about, the ability to help them decide which kind of birth they want to go through or how they want to deliver their children, and not being forced to choose a particular way because we maybe want to decongest our hospitals during COVID and all that. So how do we ensure that we look at that and focus on things beyond mortality and morbidity?
Mercy, I strongly believe and agree that women must be empowered to decide for themselves. And therefore, we have been trying to utilize multiple contact points through the antenatal and childbirth period to help women make informed decisions around safe motherhood practices, choice of birth companion, identifying referral transport, and postpartum contraception, to name a few. I would also like to add that right now, India is transitioning towards a phase of moderate levels of maternal mortality. And our analysis have shown that many of the maternal deaths occur due to delay in timely provision of comprehensive obstetric care. As a clinician myself, I understand that most of this morbidity and mortality could have been prevented through timely cesarean sections. We believe that with better quality of public health care facilities, regular cesarean section audits, adherence to SOPs in the labor room through structured interventions, we shall be able to progress faster. Another important step towards universalization of skilled birth care is introduction of midwifery nurse practitioners in India. We have prepared a detailed roadmap with an aim to scale out midwifery services throughout the country. To sum up, respectful maternity care is a top priority for India, and we are working with a multitude of service providers to this end.
Thank you very much, Dr. Harsh. And, I'll just end it there on respectful maternity care. But please, ladies and gentlemen, keep discussing on chat, keep discussing on social media, because this is not something that ends today. Even after these 4 hours, we still need to push for the rights and health and well-being of women, of maternal, child, newborn, and adolescents' health. Now, there are dozens of women who are watching you now, Dr. Harsh, from your country, India, and hundreds, thousands from all over the world. They are demanding for quality, dignified, and respectful maternal health services. Can you commit to that?
India has been a strong proponent of democratic systems, and we believe in hearing out the voices of the people and respecting their views, opinions, and demands. India is one of the countries that was instrumental in shaping this PMNCH call to action, and we reiterate our commitment to the women, children, and adolescents of India, and we will continuously direct our efforts towards improving their health and well-being. I will also urge the government counterparts and the wider PMNCH community to come forth and state and commit their support and resources towards this call to action and greater good. Let's ensure health for all and that no one is left behind.
Thank you very much, Honorable Dr. Harshvardhan, and thank you for your insights and your pledge. Please remain on screen, and for any of our viewers, the audience, if you have any questions for any of these panelists, please put it down on chat or just share your experiences and thoughts. And Jen will pass some of the questions to me, and we'll be able to shoot them to this amazing panel that we have. Now, let's talk about water sanitation and hygiene. And we all know that action in the wash sector is very critical for both containing the coronavirus and lowering its immediate impact in aftermath. So safe wash services, they are very essential, not only in the healthcare facilities, but in our communities. We're looking at improved hand washing behavior, food hygiene, safe water practices, and these are really essential to prevent further transmission. I will start with you, Pauline. What has your experience been in the last 6 months as a youth, especially navigating COVID-19 and accessing essential wash services?
Thank you very much, Mercy. So over the last 6 months, first of all, I come from, my organization is called Organization of Africa Youth Kenya, and we are a youth-led organization and also a lead partner for the PMNCH Advocating for Change for Adolescents Toolkit. So my line of work is mainly with adolescents and young people. And for the last 6 months, or at the beginning of the pandemic, we conducted a survey with adolescents and young people, basically the people that we work with, on the impacts of COVID. And just to say the least, wash is more pronounced during this pandemic. And because of the control measures for the pandemic that require that you wash your hands for a minimum of 20 seconds, and that is after almost contact with everything that you come across, I assure you that young people, adolescents and young people have had quite a task. And some of them have had to travel or to walk long distances to fetch water. And then when you come back with your water, you are torn between using it for drinking, for cooking, or just putting it aside for washing your hands and disinfecting the surfaces. And most for adolescent girls that have just had their first menses. So you can imagine if you're an adolescent girl living in Kenya in the middle of a pandemic and you don't have access to water, you don't have access to soap, you don't have access to the basic PPEs that are required, like hand sanitizers, it's been quite a task. And I think it's good to be having our decision makers on this virtual engagement platform. At least I'm sure they've had a chance to see some of these things that are happening in our country, especially regarding wash, especially during this pandemic. People living in the cities have no access to water because sometimes the cost of water is high. You find that in some places a unit of water goes for $3, and you find that the requirements of this pandemic are so, for the control of the pandemic, require a continuous supply of water. and clean water for that matter. So it's been quite a task, and young people have had quite a challenge navigating through the pandemic. And in addition to that, having to weigh between using your money, your hard-earned money, which has the pandemic has been has posed a challenge to livelihood sources. So you can imagine having to choose between buying food and buying water for cleaning or for just ensuring that there's you are in a sanitized place, so that you are able to curb the spread of this COVID-19. So young people and adolescents have had quite a task managing through the pandemic. However, as an organization, we've been able to train young women. In some parts of the country, in Kisumu County, we were able to train young women on soap making, so that in addition to
Pauline, allow me
so that
just before you go into what your organization is doing, allow me to bring Professor Margaret Kobier again back here and just ask you this question. Professor Kobier, as Pauline says, access to wash services is considered a luxury for millions of Kenyans. Now, why should I, as a woman, choose between drinking water, washing my hands, or even taking a bath during my periods? And as you reflect on this, is the Kenyan government contemplating on building long-term, sustained solutions and behavior change when it comes to resilient wash programs in relation to women and adolescents and girls?
Thank you very much, Mercy. What Pauline is saying is true. In Kenya, we do experience that 50% of the Kenyans do not have access to water. And for that reason, you can imagine now when COVID set in, the demand for such a service. Therefore, what generally we understand is women want clean health facilities, including the toilets and including the bathrooms. So what has the Kenya government done in that connection? Of course, Mercy, you must understand also government takes care of everybody. The 50 million or so. So sometimes there are not enough resources to reach everywhere. But the government also sets a minimum standard that must at least be achieved to be able to benefit from the resources that the country has. So the Kenya government vision is actually to have a clean, healthy nation free from sanitation and hygiene-related diseases. I think the Ministry of Health has already demonstrated that if we hand water, besides saving women time they go to fetch water, we would cut down also on diseases that come to the citizen. Therefore, the government has prioritized access to water to improve sanitation from 50% to something like 80%, and by the year 2030, we would want to see 100% of access to sanitation and hygiene, and especially water. In the informal sector, the government during COVID, it has already dug about 100 boreholes in Kibera, for those of you who know, and the other places like Mukuru Kwajenga. And also in our country, in the rural area, the government has dug some dams. We have also gone towards implementing what we call Kenya Environmental Sanitation Policy, and also we have Ministry of Policy, which also has strategies of how we increase access to water and sanitation in both across the country. Therefore, one is trying to work very hard, increase the budget to have access, because we must have access to water. So our unit is to what extent every year are we having more women and girls access water for their own domestic use, and of course with this increased demand now of COVID. The other area is government has also partnered with the civil societies, and I think that's where Pauline would come in, that we are struggling to answer the question, how do we train women and girls so that they can be able to access water, and even how can they go with these boreholes that have been established and go to some small businesses, how they run this water so that they can be able to use as a way of motivating. Therefore, working with the private sector, working with the communities, Nyumba Kumi in particular, Nyumba Kumi is the smallest structure, is the one which will make sure there's a water point, the water point is safe, and everybody is getting access. Therefore, the government has been working hard on these areas. Of course, sometimes the resources are not enough, and not every, but I can tell you, we have increased right now. We have about 18 million children, girls and the younger children going to school. And what the government has decided, every school must have water, must have soap, and it must also be able to sanitize if our schools are going to open. Therefore, what COVID has done has set more spotlight on the need for improved sanitation and hygiene more than before. Therefore, I see a situation where the government is also appreciating what the UNICEF and done with the WASH program, which was here in Kenya. It has worked in 11 counties, and we hope with this increased demand, we can move from 11 counties to more than maybe close to 20. So with those commitments of why haven't we fulfilled our commitment in the past, the resources have been a problem, and that's why partnership is very key. And we can count several organizations who have partnered in Kenya to improve access to water and also to be able to improve the policies moving towards improving the sanitation for women and girls. Of course,
and allow me to stop you there because
okay.
you're mentioning partnerships and resources, and I think that's why we're here today, to build those partnerships. And allow me to end this panel here, and our heartfelt gratitude to you all, Dr. Harsh Badan, Professor Margaret Kobi, and Pauline Anyona, for your amazing insights on respectful and dignified care, and also WASH. And now you'll allow me to move to the second panel in this session that will discuss issues around essential sexual and reproductive health services and supplies, and more and better trained midwives. So joining me on stage are Ms. Oriana Lopez Uribe, Executive Director of Balance and spokesperson for Maria Fund. Maria being the Spanish acronym for Women, Abortion, Reproduction, Information, and Accompaniment. We also have Honorable Dr. Hugo Ramirez, Vice Minister of Health, Mexico. Oriana and Dr. Ramirez will discuss provision and availability of essential sexual and reproductive health rights services and supplies. And from Nigeria, allow me to welcome Dr. Abiola Afolabi, a Nigerian lawyer and civil rights activist. She is also the Executive Director of Women Advocates Research and Documentation Center. And lastly, Honorable Dr. Osagie Ehanire, Minister of Health of Nigeria. Thank you so much for joining us and for your time today. Please put your video on if you've not put your video on.
Dr. Lopez Gatell is about to connect to the session. So thank you. Good to meet you, Mercy.
All right, that's great. That's great. Is Oriana here? Hey,
Yes.
Oriana, nice to see you. Thank you for joining us. And, as we wait for just one more person to join us, maybe I can start, with you, Oriana. And no, before I go there, please, guys, I hope you are tweeting and talking about this conversation on social media. The hashtag is #AccountabilityMatters. And yes, back to Oriana. I have read a little bit about you, your childhood in Mexico, and the work you do now. And let's take a trip down memory lane. How old were you when you were exposed to reproductive health products like condoms? Very short answer.
I think that I was maybe 8 years old or younger, because my family worked also in family planning in Mexico in a big organization called MEXFAM. So I grew up among contraceptives and sexuality education materials.
And that was quite a privilege, right? To have such information. And sadly, and you would agree with me that that is information that millions of girls in Mexico do not have access to today, right?
That is true. And it's a shame that still we don't have sexuality education and we don't have access to proper counseling on contraceptives, especially for adolescent girls. There's social barriers to actually providing contraceptives to young adolescents. And even to women, if they decide that they want to be sterilized, and if they are 27-year-old and they already have children, the doctors often say they're too young to be sterilized, and they don't know if they will want to have more children. So it is a problem of actually empowering and listening to women and adolescents of what they want. It's actually a missed opportunity to give them all the information and all the access to the services and the contraceptives that they need.
And Brad, and do you have adequate campaigns to ensure that this information gets to them? I don't know if Dr. Ramirez is here yet.
Sorry?
Is Dr. Ramirez here? Oh, great.
Dr. Lopez is still. I think it has been a missed opportunity for the past 20 years that there hasn't been enough campaigns on sexuality and on contraceptives in particular. And I think that it's still, like right now for the pandemic, we all know that unwanted pregnancies is going to be one of the highest numbers because of the isolation, because of being at home with your partner, but also because of sexual abuse and sexual violence. And this is something that is going to be increasing and increasing. And still, there hasn't been enough or accurate campaigns on contraceptives and on how to get them. And we listened yesterday, Dr. Bebichevsky was talking about how the government has been buying all the contraceptives. And so there's this effort at the high level and the executive government that is trying to ensure the distribution and dissemination of supplies. But I think that it's more about the social barriers that are happening and the lack of campaigns, as you said, Mercy, that there's not enough campaigns and people don't know how to access contraceptives. They don't know that they're free, and they don't know that they have the option to decide freely what are the options available for them because of their specific needs in terms of health and in terms of reproduction wishes and family planning. But also because the providers still think that it is about their choice as providers and not about women's choice and adolescents' choice. So there's still a gap there in terms of women's rights and adolescent rights to make their own choices on their reproductive health.
Dr. Hugo, you're here, and basically, you've heard what Oriana is saying. What is the government and specifically your ministry doing about this to ensure that sexual reproductive health information and services are accessed by as many women and girls as possible, especially during this pandemic?
Thank you, Mercy. Let me introduce myself. My name is Carla Berdichevsky. I'm the General Director for the National Center for Gender Equity and Reproductive Health, filling in for Dr. Lopez-Gatell while he is able to get here to the meeting room. Well, we have worked in different front lines, but specifically thinking of contraception, we have worked very hardly, intensely to secure these commodities so that they are available nationwide through our nationwide public health services. We have a total of 15 different contraceptive methods that are available for the population to be accessed without cost. So at the national level, we have procured these commodities and have guaranteed that these are available at the state level. And then there is also a line of work within the states where we need to guarantee that these different contraceptive methods are distributed evenly to the service point. And this is a way of ensuring that when our adolescents or when any woman or man is looking for any of these contraceptive methods, that there is sufficient choice for a balanced counseling process to occur between the health providers and the users, so that we are tackling their needs and that their contraceptive needs are met. However, as Oriana signals out, we do still recognize that there is a gap between what these users know about these methods, about their availability at the service points, and about how to access them. And sometimes the internal distribution within a state level system does not allow for all of these methods to be available at the same time, which also limits the choice that is available at a certain point. Thank you.
Well, thank you, Carla, and thank you for stepping in for Dr. Hugo. And I hope you can be able to answer my next question too, but you have answered that really well. So I'm confident in your ability to do this. And, in your country, there have been reports of politicians pushing conservative agendas, basically affecting the recognition and access to sexual and reproductive health rights for women. For example, seeking to block access of comprehensive sexuality education for youth and adolescents in public schools. Does this concern you, keeping in mind that Mexico has one of the highest rates of teenage pregnancies?
Of course, it is of concern to us at the national level. Our policies, first of all, are based on evidence. They are based on basic human rights, but specifically are based on sexual and reproductive health rights. So it is our duty to work with, for example, legislators that are promoting conservative modifications to, for example, very local laws to counter arrest these measures that are in a way making policy more conservative at a state level. It is our commitment at a national level to have these policies in place nationwide and to work with those that are promoting lines that are against these very progressive measures to modify health service provision to include a view on rights, on an integral aspect of sexual and reproductive health care at the highest standards to actually move forward on our agenda at a policy level. Thank you, Mercy.
Thank you, Carla. And one final question to both Oriana and you. And Oriana, you can come in first before Carla answers these. There have been also concerns that the Mexican government is using this pandemic as an excuse to cut funding to women's services. And, this began way back before the pandemic. In 2019, President Manuel slashed funds for CSOs as part of austerity measures, and women's NGOs and indigenous and Afro-Mexican women shelters are among those affected. What is the general feel about this, Oriana?
I think that there has been a government approach to civil society organizations in a non-collaborative way in terms of accusing everyone to be corrupt and also putting measures and narratives in the public sphere in terms of how NGOs can be corrupt. And I think that is a total misunderstanding of how NGOs could actually collaborate more and collaborate with the government to make a better response, a more comprehensive response right now with the pandemic, but in general with violence. But Mexico faces the highest rates of violence against women. We have a lot of femicides. And right now, this is one of the main asks from the feminist movement is that we need a proper response to the violence against women. And this is one of the things that I think that the movement is already like it's in the streets. It's taking up authority spaces to make themselves heard, and need to listen carefully on how to build those bridges. NGOs would be those bridges within the movement and within the government for comprehensive sexuality education, for access to contraceptives, for abortion. And for example, abortion is one of the things that we know with the medical abortion, with the self-managed medical abortion. Supplies are out there, but the information is not there. And I think that there is a role for the government to specifically support and facilitate that there's a strategic system of telehealth that will actually facilitate the correct information for safe abortion across the country. We need to have campaigns that ensure that both providers but also users know about sexual and reproductive rights of women and children, and they know about how they need to facilitate the access to all of these things: abortion, contraceptives, sexual and reproductive health services for adolescents including, and without the social barriers of thinking that there is a parental consent needed. There is no parental consent needed for education. There is no parental consent needed for access to contraceptives, and there is no parental consent needed in the cases of abortion when it's because of a rape, for example, which is one of the main indications that is across the country. So I think that there is an essential collaboration to be made, and this narrative of like antagonizing the government with the NGOs is not supporting that, and is not also using our efforts and our expertise towards a better advancement of people's rights.
Well, thank you very much, Oriana. And I've just seen Dr. Hugo has just walked in. Thank you for joining us. Yeah, hi. Carla did hold up really well for you. So I'll just ask you one more question and then you'll commit to the call to action. But thank you for joining us. And just before you walked in, or as you walked in, we were talking about, you know, the government cutting funds to what we call some of them, you know, shelters and all these CSOs that are dealing with women and ensuring their reproductive health and maternal health is taken care of. And, you know, cutting funds puts some of the most vulnerable women in your country, including pregnant women in rural areas who relied on shelters and care during their pregnancies and to give birth and to access reproductive health services in life-threatening situations. These women are essentially under your docket. They are what you've been tasked to take care of. Does this concern you, Dr. Hugo, and what are you doing about it?
Thank you very much for bringing this up and for hosting this conversation. I want to express a few things to contextualize my answer. One is that ever since this administration started in December 1st, 2018, we have been exposed to a number of criticisms coming from a wide variety of civil organizations and some foundations or international organizations, identifying the possibility, at least sometimes it's a direct claim, that we are cutting funds across the spectrum of public invest and public finance. I must highlight and stress quite clearly that this is not the case. What is not the case is that this government wants to reduce public expenditure in social programs, any social program. We do not attend to that. But what we are certainly doing, and is framed within austerity policies, a package of austerity policies, is to reduce those funds that are not going to the core of the matter. We critically review the administrative practices of previous administrations and found out that there was a substantial bias of the funds going to just maintain or feed bureaucratic apparatuses that were not necessarily the best way to use the money. The point is, we are not reducing the funds that go to the purpose of the institutions or the matters, but the apparatus that was, to our view, really excessive. We definitely are reducing funds to that. So when you analyze, when you see the numbers, anyone that revises the numbers may see that we reduce the proportion of funds going to this program, that program, that program. But what is going on is that we are trying to attain efficiency in the use of the public budget. This is one part. So just very, very briefly to put the other element of context. Also, the relation between government and civil organizations, all sorts or different sorts. We believe that it was distorted during several years in previous administrations by this upbringing of intermediaries. A number, not everyone, I must be clear, not everyone, and it's not a matter of prejudice towards the participation of civil society or organized civil society. It's not a prejudice. But case by case, we have been analyzing a huge proportion of relationships between civil organizations and the government that were unproductive, to say the least. And the typical case is, again, budget being used for intermediaries that are not bringing value or generating value to the substance, to the matter that is at stake. So in those cases, we are also reducing budgets.
Thank you very much, Dr. Hugo. And allow me to stop you there and just move to Nigeria, because we need to address a really, really important issue before we wrap up this session. And Dr. Osagiri, you are online. Thank you very much for joining us now. In your country, in Ghana and in Kenya, and several other countries, there are health workers, including nurses and midwives, who have gone on strike demanding proper PPE kits, personal protective equipment, and also expressing welfare concerns, issues to do with pay and just how our governments respond to their needs. I thought if there was a time that governments should prioritize the well-being of nurses and midwives, it should be now. Like, how do you expect them to take care of our mothers, sisters, children in this pandemic if they themselves are not taken care of? I mean, you cannot give from an empty cup, can you?
Thank you. A good question. In Nigeria, government policy is to take good care of health workers. Health workers are prioritized, and they are working very hard, particularly those at the front line in response to the present COVID-19 challenge all over the world. We have our own share of the challenges. As you know, not all African countries manufacture these things. They have to be purchased, they have to be imported from outside. Now we can see that there are various manufacturers trying to get into the business, or who are already in the business of manufacturing. But the quantities that were required here at the beginning were beyond the local capacity. But right now we have no problem with supplying personal protective equipment anymore. We have taken care of many of the requirements of the health sector. A lot of the modes of contention are not subject matter of present challenges, but from way behind, from some 4 or 5 years ago, grievances of 4 or 5 years ago, which pop up along with the complaints. But we do give to all our health workers a hazard allowance, life insurance, and assurance of protection from infection.
Thank you very much. And Abiola, I think you've heard what your minister is saying, and just a few days ago, your organization really put the government on the spot because you felt like it was not being accountable in all these things it's saying it's doing, provision of supplies and taking care of women. And your argument was that women are the most affected you have audience with your Minister of Health. What do you want to see done in relation to this accountability and, all that he's referred to?
Thank you very much, and this is a very good opportunity, and well done, Messi, for the work you're doing. I think the first thing that the government of Nigeria is expected to do is first to ensure that there's inclusion. Accountability has to also do with openness and inclusion. If you look at the task force that is actually directing the process of COVID-19, there's exclusion of women in that task force. So there's a question of women not being part of the decisions that are made. And that's why you see that most of the people that are suffering among the health workers, all the health workers are suffering, are more of the nurses and midwives, and majority of them are women. There's a major issue of transparency and accountability. Even in terms of information, a lot of funds seems to have gone into the whole COVID-19 conversation. But unfortunately, we don't get to hear. There are a whole lot of application of freedom of information, which has been sent to government to explain to us in terms of what they are collecting and how the funds are being spent. And because what we see as working with women in communities is that you see nurses that are wearing face masks, that are not surgical face masks. You see PPE not being enough, not adequate, for nurses. Even those nurses who contacted COVID-19, there are complaints all over that they were not compensated, their family were not taken care of, and the allowances were not given. In the last 3 months, since COVID-19 started, there has been about 3 strikes. The third strike was just recently averted by health workers. So I feel that the government of Nigeria needs to do more in terms of supporting health workers in Nigeria.
Thank you very much, Abila, for being so brave. And Dr. Osagire, is that too much of an ask from Abiola? And just based on what you've had today and what you've heard from her, how do you commit to the PMNCH call to action?
The glass can be either half empty or half full. I see the glass as half full. There is a lot that has happened since this government came over. This particular administration came in I think, August last year. That's when ministers were sworn in. And they were confronted with this outbreak. As I said just now, a lot of things had to be procured from outside the country. We had just a few laboratories. We had just a few protective equipment and a few ventilators. We really scrambled a lot. And if the last speaker knows exactly what happened in here, they would really know that it wasn't as easy as it is now. We had to do a lot of training, that's COVID-related training, infection prevention and control, and also other kinds of training in case management. All of that is being accomplished. Even as we speak, we have to train intensivists because we have ventilators and we don't have enough people to operate these ventilators. We're a country of 200 million people, and we are looking at the entire country. We're setting up sample collection sites in rural areas, in various local governments and wards. And of course, in all of these, a lot of old grievances came up. There are people who were expecting far more that could have been given at that very moment. But even before the questions were asked, we already put in a hazard allowance, which was given to all the workers. It was discussed and given. And then the life insurance and the pay, everything is given. In fact, the salaries are all well paid and paid on time. The only thing that was a bone of contention was the allowance, which wasn't processed very early. And I did assure all the workers that the allowance was on the way. The Ministry of Finance has to process it, has to go through administrative processes. So I think it's good to see that a lot was done. We do not have any of the worst statistics to see in the world. A lot of action has gone into getting us where we are now. As for the PTF, which we are talking about, the Presidential Task Force, well, it wasn't chosen according to gender. It was chosen according to religion, for that matter. It was chosen according to function. We have the Secretary to the government. You have a few ministers. There are several female ministers, but their portfolio, one minister's portfolio falls in there, and that's the Minister of Humanitarian Affairs. She's a female. But it's according to your portfolio. But if you come to the Ministry of Health, you see that women are very well represented. I personally don't look at my officers from point of view of gender or anything. So far, you are doing a good job. You are doing it very well. But if you want to look at the gender balance, in fact, there's more of high-ranking female than male. But as I say, I'm looking at the performance. They perform very well. So gender issues here should be brought in with a lot of reservation.
Thank you very much, Honorable Minister, and I would love to disagree with you. I think we need to really focus on gender and the number of women we're bringing on the table. Sorry to say, but when we talk about accountability and we talk about inclusivity and taking care of women, children, and adolescents, we cannot address this if we do not have enough representation in politics, in health, in all these things we're talking of. And I know we can talk about these over and over and, and take a long time on this, but yeah, that's a discussion that we can have another time. But gender, I think all of us agree, is very important in these discussions. And just before we wrap up this session, I'll go back to Oriana very briefly. You did not have a chance to, react to what Dr. Hugo said. So in 30 seconds, just a brief comment, then we move on.
Yes, I would ask Hugo Lopez Gatell to please take a look to the Observatory on Gender and COVID-19 in Mexico. This, as several organizations in Mexico have created this monitoring system. So we are updating it every month with a specific recommendation to take care specifically of women and young adolescents during this pandemic. So I would ask for that to be made from the government, to take a look at that and make it a collaboration, a real collaboration, hopefully to improve the life of Mexican women and adolescent girls.
Thank you very much, Oriana. And ladies and gentlemen, that wraps up our second and final panel for the Brave Voices Bold Actions, delivering on what women want. My heartfelt gratitude to you, Oriana Lopez, to Dr. Hugo, to the Dr. Abiola, and Dr. Honorable Osage Ehanire, and everybody who's taken part in this 1 hour session. I know we would love to take the conversations going on, but we cannot do that. And just a huge thank you to all the commitments to act to ensure reproductive and maternal health care is not unsanitary, it's not undignified, and it's not under-equipped, that clean water and proper sanitation are prioritized for communities and more so for women, children, and adolescents. Thank you so much for being active on chat. And just as we end this session, I asked you a question earlier, and I'm going to ask you the same question for these chats. Like, how did you find these sessions that we just had? Whether it is a sad face or a happy face for us, please let us know. And let's keep engaging and discussing, even on social media. The hashtag still continues, hashtag accountability matters. And now let us do some fun stuff to close the Brave Voices Bold Action session. Coming up is Ms. Titilope Sunuga with some spoken word. Titilope is a writer and performer whose work has, graced stages and pages across the globe. And through her practice, she grasped for moments of tenderness and persistent joy at the intersection of Blackness and womanhood. Welcome, Titilope.
There are stories we will tell of our world suspended in time, stories of courage, pushed to its limits, the myth and magic of our survival. This is for the ones who kept going when everything stopped. Women with no days off, women with no safety net but the ones they weave with their own hands, women who already made their voices heard by the millions, who demanded respect, dignity, compassion, access to life-saving care, women who know what it means to hold courage in one hand and terror in the other. Sister, you are what legend is made of. A hero's journey into the darkest places. There is a storm brewing, a wayward wind gusting beneath your wings. It sounds like a million women saying yes, saying you are not alone, saying we are all deserving of more. This is an ode to the mothers mothering mothers, to the bodies at the margins, hands catching babies when no one else would, for the hearts beating beneath the armor, masked mouths weaving prayers on their tongues, for the ones who cradle the heads of our elders with nothing but hope between them, for the midwives who march for miles, who sit in protest, who remind us of the real lives beyond the headlines, for the women who go it alone, pull babies from their own bodies when life or death is not merely metaphoric. This is for what was lost, what was reclaimed by your audacity. This is for the roar of your truth-telling, how it echoes across the globe. You the blade, you the bomb, you now and always the birthplace of every revolution. The women are still talking, still speaking beyond fear, still demanding what was promised, what is fundamental to human life: dignity, respect, safety, access to care without judgment, without threat of violence, even now, especially now in this moment that commands a new way of being, that shows us just how long the journey forward. We are reminded that no one is safe unless we all are. What women want is what humanity wants. The women are still holding their own stories. Their persistence is a force that pierces the veil of shame, of secrets that hold us captive, of systems that falter when we need them most. So praise the women who have always led the way, who know that silence is complicit. Praise the hands across the world pushing and pulling in every direction until what harms us is dismantled, until our voices, our choices, our babies, our bodies are held sacred. The movement is here to stay. The essential act of naming what we want, what we cannot live without, of affirming that good enough is no longer enough. The women are still walking, still talking. What is radical? What is revolutionary? What is life-saving is to listen and answer with transformative action.
Dr. Mercy.
Now, in the last 3 hours and some minutes, we have heard from, such powerful voices, the lived experiences, the testimonies, voices, and commitments of leaders, policymakers, and experts. We have seen the need to secure global accountability to help us monitor our progress, identify gaps and challenges, and most important, we have realized that we need partnership and collaboration. And to that effect, it is my pleasure to welcome our next speaker, David Imbago-Jicom, board member of PMNCH Adolescent and Youth Constituency and Vice President for Development at the International Youth Health Organization. Welcome, David.
Thank you, Mercy. What an extraordinary set of speakers we have had today, and what an amazing depth and breadth of discussions. It is clear that much needs to be done to protect the progress that we have all collectively made to date in improving the health and well-being of women, children, and adolescents. And we need to work together to do more in the months and years to come. These conversations today have also further confirmed something that I have witnessed in action many times. We can all do much more if we work together rather than alone. This, in fact, is the central idea that underpins the work of the Partnership for Maternal, Newborn, and Child Health, or better known to many of us as PMNCH, of which I have had the privilege to be a board member of the Adolescent and Youth Constituency, one of the 10 constituencies that made up this unique partnership. And in just 5 years, as the youngest constituency, we have done so much together to ensure that young people themselves influence the discussions that shape their lives. But our success belongs to all of us, donors, the UN, the private sector, academia, and others. Over the years, we have seen time and again through the work of PMNCH how working together we can achieve more than alone. The partnership itself is learning and adapting to the changing world around us. In this hugely important year for the health and well-being of all of us, PMNCH was also reflective on what more it can do to support women, children, and adolescents. Over the last 12 months, all of its 1,000 plus partners have been invited to participate in the development of a new strategy, which defines how the partnership will facilitate the work of all of its partners in the years to come. This extensive and all-inclusive consultation process on the strategy was a once-in-a-lifetime experience for me personally. It enabled me, as well as my colleagues, to reflect on the origins of the partnership, as well as the unfinished agenda of the Millennium Development Goals. And at the same time, think about the future I and we collectively want to see for the women, children, and adolescents of this generation and those generations still to come. We don't want a world where we can only survive. We want a world where we can thrive and transform. The PMNCH strategy is both bold and ambitious, and is also focused and practical. It outlines a roadmap that, if implemented, will be a really important contribution that we can all make to these common objectives. I have the pleasure to present to you all today the strategy, which you will see presented in a short video to follow. For this strategy to achieve what we all want it to achieve, it requires commitment, effort, and meaningful engagement from all of us. Please join us in delivering it. Without further ado, I would like to present to you the PMNCH 2021-2025 strategy.
Today, the health and well-being of women, children, and adolescents is at a critical moment, and more needs to be done to support those most in need. The Partnership for Maternal, Newborn, and Child Health aims to do just that. we are the world's largest alliance for women's, children's, and adolescents' health and well-being. With over 1,000 partner organizations across 192 countries, we operate across global, regional, and national platforms, bringing together all constituents who have a stake in women's, children's, and adolescents' health and well-being. Our partners are united in their vision to create a world in which every woman, child, and adolescent realizes their right to health and well-being, leaving no one behind. Over the past 15 years, we have made significant steps towards this united vision, giving voice to thousands of organizations and individuals who help shape policy and services, helping to secure global agreements between 192 member states of the UN, mobilizing more than $180 billion in funding for the global strategy, and ensuring we all take accountability for our actions through the Unified Accountability Framework. Although we are in a difficult moment, as we look to the future, there is a real opportunity to protect and improve women's, children's, and adolescents' health and well-being across the world. In our PMNCH 2021 to 2025 strategy, we have set out 3 key goals to help us achieve this. To drive down preventable morbidity and mortality amongst mothers, newborns, and children, including stillbirths. To uphold essential sexual and reproductive health and rights interventions. To advance the health and well-being of adolescents. Together, we will deliver this strategy through our partnership-focused approach, achieving more than one organization could possibly hope to alone. We will act with pace and urgency, and with an unswerving commitment to the health and well-being of women, children, and adolescents worldwide, tackling not only existing issues, but the new challenges we face moving forward. In this effort, we truly are stronger together than apart. We thank you for joining us.
Powerful video and such strong ones from David. We know it is not always easy, to break down silos and engage in meaningful discussion and collective action across sectors or, issue areas. But when done effectively, partnerships are a powerful force to deliver for good. And PMNCH has been doing it, bringing together over 1,000 partners for multi-sectoral and aligned action to help drive meaningful action for women, children, and adolescent health, and to respond to the needs of this group of people. So indeed, we must build upon and just amplify one another's work rather than duplicating or competing. And that is essentially what this video is telling us. And on that note, let me welcome Lisa Hilmy, Executive Director of Core Group and PMNCH Chair of the NGO constituency, and Helga Fogston, PMNCH Executive Director. If any one of you joined us for the Lives in the Balance Summit in July, then definitely you remember these leading ladies well, and they are here with some good news. Welcome, Lisa and Helga.
Thank you, Mercy. It's great to see you again. And thank you to all of the organizers for this incredible virtual breakfast event that brought us all together. Meetings like this are so important as they give us the opportunity to come together as a community and to pause for a second, to re-energize together, something that we all need given these very trying times that we're in. And that's why I'm pleased to let you know that you will have yet another opportunity to reconvene in 2020. Core Group, with so many partners, are organizing the Unlocking Potential, prioritizing child and adolescent health in the next decade. This conference on the 6th through 8th of December, I really hope to hear and see you all at this event. Please look out for the details, which will be shared with you very soon. And we've dedicated 50% of all slots to young people on the planning committee as speakers. And we will remain accountable to meaningful youth engagement for this important conference. Watching our community come together in the way that it always does, with enthusiasm, sincerity, and conviction to learn from each other and share with each other, it really reinstates the belief in me that we can only achieve these goals that we set for ourselves when we walk in true partnership together and with each other. And as you've seen in this incredible video that David introduced, the goals that we've set for ourselves in the new PMNCH strategy are no small feat, but we can achieve them, and we will achieve them. If each one of us that are here today and around the world stands behind this strategy and commits to it. And I, for one, as the chair of the NGO constituency at PMNCH, and on behalf of the NGO constituency, I fully endorse the new PMNCH strategy. I look forward to working with all of you together to further the health and the well-being of women, children, and adolescents everywhere. And with this, over to you, my friend, Helga. I hope to see all of you in December.
Thank you so much, Lisa, and thank you, David, and thank you, Mercy. So we at the PMNCH Secretariat are thrilled to see so many of our partners putting their shoulders to this strategy, and really look forward to supporting our partners and working with you all in taking this work forward. We've chosen to launch our strategy this month because of the significance it holds for all of us. This month, PMNCH turns 15 years, a vibrant adolescent, and the EWEC movement turns 10, still a solid and very lively child. When I reflect on where we started, it is apparent that progress on maternal, child, and adolescent health would have been in serious trouble without these efforts and partnerships. It fills my heart with joy to see how far we have come as a community. So a very happy birthday to each and every one of you on our PMNCH and EWEC members. But this year is important for us in more ways than one. It denotes not only the 15th anniversary and EWEC at 10, but also the year where we risk losing so many of the gains we've made. Now, more than ever, we are being tested. We need to use the collective strength that we've built in these past 10 and 15 years to move forward and protect our progress. As we near the end of this event, I want to take a moment to reflect on something you will have heard, and I hope have felt, the importance of citizen voices and empowerment, both of which are critical parts of accountability and advocacy. The Accountability Breakfast is a place where we not only celebrate our achievements, but we call out our areas of lack of progress and hold each other accountable. The intent is not to make the event comfortable, but rather the opposite, to make us aware, to make us worried, to make us uncomfortable of our own lack of progress, and last but not least, motivate us to do more and better, to take up the baton in a more effective way and drive change. Change will not happen on its own. Your voice was at the heart of the call for action that we launched at the Lives in the Balance Summit in July. Today, as a next step, we are also launching a 24-month campaign to realize the 7 asks we have included in the call for action, for COVID. But we can't do this alone. We need your support as always. We urge you to use your voice once again in joining us in this campaign by signing an open letter that we hope to present to the UN Secretary General on UHC Day in December. The letter named Protect Our Progress helps make the 7 asks visible to all. By signing this letter, you are carrying forward the torch for action that we lit at the beginning of today's Accountability Breakfast. As I bid you farewell, at least for now, I leave you with a video of Michelle Bachelet, the UN High Commissioner for Human Rights and former PMNCH board chair, committing to protect our progress. Other leaders from our global community, such as Helen Clark, Tarja Halonen, Tedros Johan Kapangang, as Asai, to name a few, but also encourage this campaign. Let's join them in doing the same. The link to signing the letter has been shared in the chat box with you. Please take a moment, look at it, and sign it. Thank you to each and every one of you. Stay safe and motivated for action. Thank you.
My name is Michelle Bachelet, United Nations High Commissioner for Human Rights, and originally from Chile. There is no time to lose. We commit to the challenge of protecting our progress, to achieving the 2030 Sustainable Development Goals, and to refocusing our efforts to prioritize the health of women, children, and adolescents everywhere. We must protect the process achieved. As a woman, a pediatrician, a mother, and a grandmother, as well as 2 times President of Chile, I'm convinced that prioritizing and investing in women's and children's health and well-being is crucial, as it ensures societies that are more just, fair, prosperous, peaceful, and sustainable. This is why and how we can build back better in the aftermath of COVID-19.
Indeed, that's very true. We cannot even debate about time now. We need to protect our progress. We need to act, and we need brave voices to come up. And it's not next week, it's not next year. We need to act now if we need to just keep what we have achieved and even achieve more. And ladies and gentlemen, we are coming to the end of this 4-hour event that we've been having. And as we go into the last minutes, there's one simple final poll for you. Please do let us know what you enjoyed most about today. And this poll is already live in the poll section. Just scroll down and let us know what you enjoyed most about today. And even as I welcome our final speaker of the day, Mohamed Sidibe. Mohamed is a youth activist from Sierra Leone, and he is the education champion for the Global Partnership for Education and a champion for justice and accountability for the rights of women, children, and adolescents everywhere. He is the symbol of our call to action today. Welcome to our virtual stage, Mohamed.
Thank you very much, Marcy. Thank you for the kind introduction. I'm honored to be the final speaker in this 4-hour event and acknowledge the efforts of all the partners in putting together a great program, especially PMNCH, White Ribbon Alliance, and Every Woman, Every Child. I'm delighted to be joining from Paris, not with everyone physically, but it is great to be with people from all over the world who have come together because they believe deeply about health, rights, and the well-being of people all over the world. The COVID crisis has exposed several weaknesses in global education, health, and social protection. Yet, it also presents an opportunity to build back better and drive powerful change. We must work together to beat COVID-19 and reset our economies and communities in a fair, more equitable, and sustainable way. Children and young people around the world face an unprecedented threat to their human rights. COVID-19 school closures have affected 1.5 billion students, placing children at immediate risk of labor exploitation, hunger, recruitment into armed force groups, especially for girls, child marriage, and sexual violence. Decades of gains are under threat, which is why I encourage you all to sign the petition we just learned about today to protect the progress. You see, this global crisis has shown us that the gains are fragile And it has highlighted how critical health and education are to the vitality and well-being of society. Schools are more than the brick and mortar buildings. They provide a broader social functions in communities. For many, schools is where kids are fed, receive health care, and access to clean water and sanitation. My personal success is only possible because I was given the opportunity and access to receive quality education. So when I was 5 years old, the Revolutionary United Front, RUF, arrived in my village and murdered my entire family, gave me a gun, and forced me to be a child soldier. I was a child soldier from 5 until I was 9.5 years old, which was the first time I stepped foot inside of a classroom with the help of UNICEF. See, the fiction is no child should ever have to rely on fortuity to receive that which is rightfully theirs, the right to education. Education should never be politicized. It should never be about where you're from, or your nationality, or your country of birth, or your citizenship, or the status of your family that determines that which is rightfully yours. Quality education. So we cannot continue to live in the world where your social status or the status of your family determines your place and the knowledge that you receive. We need to stop kidding ourselves. The SDGs can only be realized with strong global partnership and cooperation. All of us working together. And we need our world leaders to keep their promises for the health, right, and well-being of women, children, and adolescents everywhere. We cannot have forward-looking goals while taking backward steps. We cannot promise a better future while all our actions indicate otherwise. We must fund education because it is the only way out. See, accountability for commitment, reforms, and financing is key. Organizations here today in the Global Partnership for Education, with whom I am a champion, they know this too well. In working with countries to build stronger education systems. So GPE's newly launched Education Out Loud Fund promises to open a pathway for better, more effective education advocacy along with accountability and engagement. As the largest fund dedicated to advocacy, transparency, and accountability in education, EOL aims to help strengthen education systems and improve the effectiveness of national education policy, the implementation, so that all children can receive inclusive and equitable education that will help them reach their full potential. Every child and young person deserves to be healthy, educated, and safe. To achieve this, we need to come together now more than ever to protect the progress and work to ensure that everyone gain access to quality education. We cannot afford to lose the gains we've already made. See, we were behind before COVID. If we continue at the same pace, we will never catch up. We need to change our pace. We need to fund education. See, as young people and citizens, we are the cold face of accountability. Now more than ever before, let's use our power, our voice, our vote today to demand that leaders use their abilities to make the change we need to ensure that no one is left behind. I know that together we can advance the health and well-being of women and children and adolescents everywhere. But I leave you with one question. How are you playing your part to protect the progress? Thank you.
Wow, Mohammed, you are inspirational. Absolutely no better way to end this. We are talking of brave voices, and yours is definitely one of them. And ladies and gentlemen, that marks the end of the 2020 Accountability Breakfast. Thank you so much to each one of you for joining us, our panelists, speakers, and you, our audience, more than 1,500 of you watching from more than 100 countries. Your voice is absolutely important and needed in advancing everything we've talked about today. Now, on behalf of PMNCH, EWEC, and White Ribbon Alliance, on behalf of myself and Jen Rabotata, our fantastic online moderator, thank you all for your commitment, your solidarity, and for joining us today. I just all to take part, to play our part in the call to action campaign launching today. Let us protect the progress by signing the Protect the Progress play that has been linked in the chat box and is also available in the resources page of this website. And stay tuned for the December, our next Lives in the Balance event in time for Universal Health Coverage Day. Now, this event has been a labor of love and partnership, definitely, that has brought together individuals and organizations with diverse skills, experiences, perspectives, and resources to address the shared challenges and to advance women, children, and adolescent well-being. Shout out to the programmers, the communication and media team, the tech team and translators, everyone who has put their shoulder into this day. And of course, a huge thank you to our many partners who put on today's program with us. Together we shine, and let's keep the conversations happening. Bye-bye.
Destabilizing our communities and affecting women and children and adolescents. Let us leave no one behind. In a wake of the crisis, now is the time. It's time for change, it's time for change, oh yeah. It's time for change, it's time for change right now. It's time for change, it's time for change, for greater equity and accountability. Let us live beyond a COVID crisis towards a vision of a health and new world. Let's lead our people with accountability, rebuild the system and society. Let's write our own history and make a path for a brighter future. Yeah. Oh, la, la, yeah. It's time for change, it's time for change. Oh, yeah. It's time for change, it's time for change right now. It's time for change, it's time for change, for greater equity and accountability. Our leaders gotta listen up to the people that deserve, cause we only really strong as the weakest amongst us. Is it just that we make and reflecting our future? We're running out of time, cause we only get one world. Oh Lord, it's time for change, it's time for change right now. It's time for change, it's time for change right now. It's time for change, it's time for change, for greater equity and accountability. Yeah, yeah, yeah. Step it up and keep it up a da. Step it up and keep it up a da. Step it up and keep it up da 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 da. Yeah, yeah. It's time for change, it's time for change, oh. It's time for change, it's time for change right now. It's time for change, it's time for change, for greater equity and accountability. Yeah, yeah, yeah.